A very good morning to one and all. We welcome you all to the national webinar on air pollution, allergies, asthma, bronchitis, types, causes, prevention, symptoms, diagnosis, medications, interventions, treatments, and role of multidisciplinary team in health and sustainable development. On occasion of World Social Work Month, with the theme Co-Building a New Eco-Social World, Leaving No One Behind. And also World Health Day being celebrated on April 7th and is also celebrated across the month as World Health Month, and also on occasion of World Earth Day, having the themes Our Earth, Our Planet, Our Health, Clean Our Air, Water and Food, Healthier Tomorrow. And we have International Mother Earth Day on 22nd April with the theme All Together Preserve and Protect Our Health, Our Families, Our Livelihoods. Together, we must invest in our planet. Invest in our planet. So with these themes, this webinar is structured and themed accordingly to commemorate these events. So we, on behalf of Sri Holistic Health Foundation and Sri Research Institute and Center for Arts, Sciences and Wellbeing, we invite you all for this wonderful day. Before we start the proceedings, we will invoke and seek the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
Yeah, with the blessings of Almighty, we shall proceed for the further proceedings. I welcome all the participants and also today's speakers for the day. Dr. Pratish K. Kiran, MBBS, MD, DGM, President, Associate Professor, Department of Community Health, Convener of Disaster Management Unit, Faculty at the Department of Medical Education, jointly coordinating the Senior Citizen Health Service at St. John's Medical College, Bangalore, and Dr. Suresh C. Pandey, Ayurvedacharya, Kayakal. He has experience of 24 years in yoga and 24 years in naturopathy, 12 years in Ayurveda, and he is running an Ayurveda Research Center and Development in New Delhi. And Dr. K.B. Satish, Sri K.B. Satish is yoga practitioner and trainer and also advocate, and he is practicing and training in yoga in past 25 years in Bangalore. And we have Srimati D. Divya Bharati, nurse and counseling psychologist. We have Nagaraj, past president of Rotary Bangalore Abilities, member of various professional organizations, and he is also working as deputy manager, State Bank of India, Bangalore. We have Sri Arun Mohan, wellness coach, from Rotary Bangalore Abilities. He is also Governing Council member of Multiple Sclerosis Society of India, that is MSSI, and Dr. Ravindra RM, Environment, Social, Nature, Wildlife, Animal Welfare, Health Promotion, Conservation activist, also consultant, psychology, medical, psychiatric, social work and counseling. He's also spiritual mentor and guide, member of various professional associations, visiting and guest faculty. So now we again welcome all the faculties and eminent speakers and all the participants. The sessions are live in Zoom, and the participants can attend in Zoom as well as on YouTube. It is being streamed live on YouTube. So as per your convenience, you can attend. So now we invite our first speaker for the day, Sri K.B. Satish Ji, yoga practitioner and trainer and also an advocate, to kindly take over session related to the theme yoga and its practice. Satish Ji, we welcome you once again.
Thank you very much. Dr. Ravindra Ji, co-panelist, am I audible?
Yes, sir. Loud and clear.
Yeah, thank you. So, co-panelist and friends, thank you very much for the introduction. I would today's discussion is about air pollution, allergies, asthma, bronchitis, types, causes, prevention, symptoms, diagnosis, medication, intervention, treatments, role of multidisciplinary team, and sustainable health and sustainable development. And my topic for the day is yoga and its practice with this perspective. So I'd like to start by stating that I'd be talking about yoga as a wholesome, like Ashtanga yoga, rather than yoga vyayama. Since we are talking about multidisciplinary role of multidisciplinary team and the role of yoga, I would like to touch, there are most of the co-panelists are there, like a doctor and Ayurvedic practitioner and wellness coach. I think, it will be mutually complementary, and it will be, we'll be having in different faculties, we'll be doing the same things. So I'd like to just touch on all those things and focus on Ashtanga yoga. So according to the knowledge I have gained on this, I feel these issues of allergy, asthma, bronchitis are completely curable, and a person can lead a disease-free life as per the yogic practices. If a person follows yogic practices properly, he can, whatever be the stage of allergy or the disease, it can be completely cured, and a person can come out and have a proper healthy lifestyle. So I would like to go with the initial points of yoga. The cause of these diseases as per Ashtanga yoga starts with mind, body, and soul. So every disease as per yoga will have its own reason. The reason will be the thought process of a person. And your asthma disease starts with the thought process. Wrong thoughts leads to asthma disease. So if you have a right thought process, then this disease will cure. So wrong thought process is the genesis for asthma and related problems. And in yogic Ashtanga yoga, the proper solution for asthma and related issues are the right thoughts and the right way of life. So for that, Ashtanga Yoga starts with Yama, Niyama, Asana, Pranayama, Pratyahara, Dhyanam, Dharana, Samadhi. These are the 8 limbs or Ashtanga Yoga. So Yoga Vyayama is just one part of the Ashtanga Yoga. So depending on the disease and its complexities and severity, one needs to choose from where and to what extent these Ashtanga Yogas has to be correlated and involved to come out of the disease, diagnose it properly and come out of the disease. So if a person having an disease related to allergy or asthma related issues, if it is in a childhood and the disease is in its infancy or just forming stage, first and foremost is we can start with the basic legs of Yama and Niyama. It's not just for asthma, any disease, any problem that a human body or mind goes through, the solution lies in Ashtanga Yoga. So asthma is just one of it. Any problem related to human body, mind, it can be cured through Ashtanga Yoga, proper process, and it has to be followed either through the guidance of a guru or divine blessings. First and foremost thing is Niyama. So the genesis is that right now in this world, what we are following is we follow only Niyamas and not Yamas. Niyamas are like, cleanliness. Niyamas are like Santosha, Shaucha, Tapas, Swadhyaya, Ishwara Pranidhana. So what we do is, we are sticking to physical Shaucha, that is cleanliness of the body, not cleanliness of the mind. So there are 5 types of cleanliness, out of which we are focusing only on bodily cleanliness and outwardly cleanliness. Cleanliness of the mind and soul and various other things are there, which we are completely ignoring. So Ashtanga Yoga says, if we follow Ashtanga Yoga, there is no problem in this world related to a human soul that can be addressed. Hello, am I audible? Hello.
Yes, sir. Please continue.
Sorry. So right thought. So asthma starts with negative thoughts in the body and mind. So we might ask, like, in childhood, small children, they face these problems. Yes, it will be accumulated from their previous births or from their parents acquired. So right thought is required. So negative thoughts has to be completely taken out and positive thoughts have to come in. So positive, how do we bring in positive thoughts? There are various ways. Align with the right kind of people, align with the positive environment like temples, satsangs, kind of things. Japas can also do these things. So the right attitude and right thought in the mind and the right goal will be the first step towards eradication. So we should know that the cosmic law is in play. So we are all guided by cosmic law. Ashtanga Yoga is not beyond cosmic law. So unless and until we have purity of thought and purity of goal that we want to achieve, nothing in this world is going to help us. And if we have purity of thought and the goal is in alignment with the cosmic law, then nothing is going to stop us. So this is the basic underlining rule as per Ashtanga Yoga and cosmic laws. So we need to align with cosmic laws, and once we align with cosmic laws, remaining everything will come in place. We have to just follow the flow, and it will take us towards the right way, and it will guide us and take it forward. So the steps are like, right thought process is the first thing, which we can get it with, as I said, like, nama japa, right alignment with peoples and positive places, like places of worships and spiritual centers. And this is the first step. The next step is follow of yama and niyama. We take any one of the yamas and take any one of the niyamas, follow it in a simple way. The yamas and niyamas can be followed in three ways: in a sadharana level, at a middle level, and at the highest level it can be followed. So we can, to a beginner, we can start it with any one of the yamas or any one of the niyamas can be followed. So niyamas are like, ahimsa, santosha, shaucha, tapa, swadhyaya, ishvara pranidhana. And the other side of it is yama. Yama is ahimsa, satya, aparigraha, brahmacharya, asteya. We can choose any one of these yamas and any one of these niyamas. And once we follow it in a simple way, that will ensure that, our alignment with the all other faculties happens by default. So once we follow yama and niyama, that is the basic foundation. Then we need to follow certain yogic postures, that is yoga vyayama. Yoga asanas and yoga vyayamas are there. From asma point of view, there are specific yoga asanas and yoga vyayamas that can be followed. And like Uttana Bhalasana and pranayamas are there. Pranayamas, specific pranayamas for asthma is there. I would suggest not to go directly for pranayama. We need to stick to yoga vyayama first, then go to yoga asanas. And once we have achieved stability in the basic tenets of yoga, then we can go for pranayama. After yoga and pranayama, in that there are bandhanas, and all the, bandhanas are there. Then we can go to the highest levels. We can follow indirect transformations are there. We can go through the indirect transformation methods are there. We can go that. Also, there are other faculties along with yoga help out in curing this disease, like spiritual healing, pranic healing, which is nothing but an substitute or another version of yoga. So yoga is a for sure and hassle-free, without side effects way. So when we are taking pranic healing and other methods, those are very costly. We need to pay for that. And there are side effects, like, if we drift, there are chances of dramatic problems. We might face some problems. In yoga, there is no such thing. When you are following on a step-by-step basis, starting with the basic tenets, then there is no scope for danger. We are guided by the spiritual and cosmic law. So we can easily flow through the process and achieve the intended results, that is disease-free life. Along with yoga, if you are practicing yoga and Ashtanga yoga, it is a lifetime practice. It's not that we can do it for 10 minutes, 20 minutes and just get rid of it. Ashtanga yoga is a practice that is spontaneous and goes on 24/7. So that we need to realize. Unlike other fitness centers where we go do for 10 minutes, 20 minutes, 30 minutes, or once in a week or once in a couple of weeks, and then come out and forget it. This is not the way of life. Ashtanga yoga, once we are a disciple of Ashtanga yoga, it is a 24/7 practice. As far as we are with that, we are protected not just from this disease, any disease in the world or any casualties in the world. So we need to follow Ashtanga yoga. Basically, Ashtanga yoga is not taught in any schools, in any formal schooling system. Ashtanga yoga is not taught, and Ashtanga yoga is, I believe, Ashtanga yoga is a solution for most of the problems the society is facing as of now. So I'm just keeping asthma as just an what do you call, like a reason to explain Ashtanga yoga. Asthma is just one small issue that can be easily dealt with Ashtanga yoga. So yamas, niyamas, asanas, pranayamas, these are the first four limbs, and the next four limbs are pratyahara, dhyana, dharana, samadhi. So these are the next four levels. If asthma is persisting or any other physical difficulties are persisting in the body, we can't go to the next four limbs, higher levels of yoga. It can't be done. So we have to start with the basic tenets of yamas. One of the yamas we can take, basically, if you look at asthma, we can suggest one of the yamas, like, Satya is one of the yamas which is very easily followable for asthma. Instead of any other yamas, Satya is one of the yamas that is directly related to asthma related issues. So an asthma patient has to follow Satya at the basic level, middle level, or the highest level, depending on the level of severity of the disease the person is going through. Along with that, all niyamas can be followed in guidance with a spiritual guru, which they will guide depending on the disease, and person to person basis. It will be a direct intervention by the guru. Will be through guru, the divine will guide the disciple out of the disease. Yama, niyama, and asanas. So after a certain stage, the divine will take care of the disciple directly, and there will be an inner voice within the disciple which can be followed in the absence of guru, and that will take the disciple out of this disease. So I vehemently suggest that not just for asthma, for any and every problem the society is facing, first and foremost thing is Ashtanga yoga that has to be brought into the formal education system in this country. This is one point solution for most of the problems that we are facing, and the present education system that we are being educated with is just for materialistic gains, and Ashtanga yoga is for not just material gains, also for spiritual gains and ultimate goal of the soul. So I would like to suggest that keeping asthma as a reason or as an reason, I would like to promote Ashtanga Yoga rather than Yoga Vyayama, which is just a limb of Ashtanga Yoga. And I would like to go ahead and tell that this Ashtanga Yoga is part of cosmic laws. Patanjali Maharshi is one of the person who one of the exponent of yoga asanas. If we go little deep into yoga asanas, I would like to suggest tell that every human being or every creature in the world is blessed with yogas, direct or indirect. Except for human beings, most of the creatures in the beings in the world have indirect yoga format in their mind. So every animal in every creature in the world will be following yoga, and accordingly their body will be, they'll be having benefits of the yogas they are following. Human beings can follow any of the most of the yogas, and there are I think around 84,000 yogas. The first yoga is what where human when a human I mean a soul enters the body, garbhasana, and the last yoga that the body undergoes is shavasana, that is in the death asana. So we come with our hands folded, garbhasana, that is the most important yoga in the world, which gives immunity and strength and stamina to the human body. The yoga that we do when we are inside the garbha of mother, womb of mother. And the last yoga we follow is shavasana, when our hands are completely empty and open. So in between we have 84,000 kinds of yogas are there, and it is for well-being of the human beings that these are there, that can be made use of. Entire things can be followed knowingly, unknowingly we follow it. When our body mind goes through turbulence and different environments, by default the yogas, we follow certain yoga postures. We can see child sitting, and when a 1-year-old child will be holding a different kind of mudras. When the child grows into 2 years, the child will be doing different kind of mudras by hand, Saraswati mudra, and different kind of mudras will be. So those are embedded in our body, and we have all those things. So those things have to be just tapped, and depending on the body, mind, soul, and the nature of the soul, a guru can identify and guide which are the best things for the soul, and through the guru, the divine will guide us. So this is a little bit knowledge that I believe that I wanted to share with these co-participants. I think uh, few of you will be knowing much more, and I think if I have committed anything which I have left out anything, I think my co-panelists can add up. I think these are the things I wanted to share with my friends, and with this, I would like to conclude with my points that Ashtanga Yoga is the requirement of the day, for not just for asthma, but for the entire world uh, order, for entire human race. Ashtanga Yoga, for well-being of the universe, Ashtanga Yoga is required. That has to be brought into the formal education system, and that has to, our education system has to change from materialistic education to include all-inclusive education system, of which Ashtanga Yoga is one and the first and the foremost basic fundamental education system that is to be adapted. Thank you very much, and I open this forum for any questions if any of you have on this issue. Hello.
Thank you, Sadishji, for giving insights into yoga and different branches of your systems, practices of yoga. And also, there is a myth and conception because of lack of knowledge and awareness among the public or the citizens that yoga is only for attaining moksha or liberation or something. But yoga can be practiced, and I think yoga should be part of lifestyle, which was there as part of lifestyle, but due to our very limited sedentary life and very limited routines and limited job roles that we are performing, we lost those practices which are part of our lifestyle itself.
Yes.
It is imbibed as part of our DNA itself, as so that we, as you already mentioned, the child knows, performs all the yogas without conscious, with or without conscious
Yes.
cognizance.
Yes.
So that is there in our DNA, but due to our restricted mobility or restricted job profiles,
Wrong thought
very much
process.
limited, and also the thought process. So definitely, as you said, it has to go into back into the system,
Yes.
back into the curriculum, so that we all learn and practice yoga. And yoga has already, maybe in simple terms, to have a better understanding, it can be called in a simple term an exercise as well. So, though yoga is a bigger term, an umbrella term, and is a larger term, but for a simple understanding, for even for a novice also, we
Yes.
can call it as a simple exercise that can be a one-stop solution for many lifestyle disorders or diseases,
Yes.
including asthma. Very well
Yes.
conveyed, sir, the message.
Thank
And
you.
as you already said, like different disciplines has to come together, because whenever there is an acute emergency situation, definitely the modern medicine has to come to place.
Yes.
We cannot avoid that. At that time, we cannot sit into the yoga posture and do, because to attain that stage itself is very difficult. And when you are unable to breathe, you
Yes.
cannot sit and calmly and do yoga. In a
Yes.
similar way, we all work together, all disciplines work together at different stages of life and different stages of diseases or disorders in
Yes.
prevention, primary, secondary, tertiary care. So all have to play a very important role that will not only help to reduce the burden on the health infrastructure and the doctors also, doctors, allied medical, allied health professionals and all. This is very much important, and thank you. So participants, if you have any queries, you can put it in your put it in chat box, or you can raise your hand, or you can unmute yourself. If you are unable to unmute, you can raise your hand. We can unmute. We have, yeah, Mary ma'am.
Hi, sir.
Hello.
Actually, it was a very informative session, sir. Many times you have said me that you train yoga, but have not experiences. Today, it was a very informative talk. A lot of takeaway, not questions, but a lot of takeaway for me for yoga, because I'm new to yoga. So I lot of takeaway. Thank you very much for coming over and presenting, sir. And my heartfelt gratitude to you, and very informative. And I jot down a lot of points. So all the best, sir, and all the best for your life also.
Thank you. Thank you very much.
Thank you, Mary ma'am. Thank you, Satish ji. Any, we have next participants waiting to comment. Yeah, Divya, please go ahead with it.
Namaste, sir. First of all, I want to congratulate you, sir. Your session is very well, very informative. And my query is it possible to do a Ashtanga yoga for a woman who has undergone LSCS?
Yeah, I didn't get you. A woman who has undergone?
LSCS, sir, cesarean section.
Ashtanga Yoga is, I think you have not got the process of Ashtanga Yoga properly. Ashtanga Yoga can be practiced by even a person in deathbed. Depending on the body condition, mind and soul, it can be practiced. So all you need is a guru's guidance. Even a person on deathbed, if you can see this something called as, Vaikunta, this thing, but someone on deathbed, they come and ask him to catch hold of the calf's or a cow's tail. that is a symbolic way of doing it, but actual practice of Ashtanga Yoga is something different. We have to practice from the childhood. Anyone at any point of time in life, at any stage of disease, can follow this. Only thing, as I said to you, our goal should be pious goal in alignment with cosmic law. Only then the cosmic law will send you a guru, and through the guru you will get an initiation into Ashtanga Yoga. Otherwise, from your end, you should have a bank balance from your previous birth. Got it? So if you have a bank balance from your previous birth, then you from your end, you can strive and follow it, and to an extent you can follow. Then the spiritual, the spiritual and the positive energies will take you forward.
Yes, sir, but it is, I think that it is any scientific proof that you are explaining, but the people will asking me like this question, what should I answer them?
Scientific proof, it's scientifically proved. All these things what I'm talking now is been scientifically proved and recorded. I'm not talking something beyond it. Science is just one small faculty in it. This is beyond what you call as science, which has come from the Western point of view and recorded. Okay, some few hundreds of years back, science, what you call the present science. What I'm talking about is well proved and well documented. Well proved and well documented. We can take a person with asthma or any disease and take him and let him have the proper thought process, proper initiation, proper thought process, and then he follows these yamas and niyamas at the basic level. We can document it. It has been documented. Nowadays, what is happening is all these faculties like, yoga, Ashtanga Yoga, and what you call healing, spiritual healing, and all those things and all have been documented. All those things have been documented because this has been challenged unscientific due to the present modern science. It has been challenged, so it has been documented and it has been proved beyond doubt. I myself have documented it. And it has come in modern scientific document. It has come. The energy level, fluctuation of energy level when following this is more than 100%. Hello?
Yes,
Are you there?
Did you get it, ma? Okay. Yeah. Thank you, sir.
Yes, sir.
Anyone else? Yeah, she got it, it seems. She has texted. Okay, someone raised their hand before. Ramesh, would you like to, do you have any comments? Let me unmute. Ramesh?
So no, thanks.
Okay, ma'am. You can mute yourself. Okay, as Satyajji has already mentioned, see, maybe in yoga also, based on the complexity level, there are certain yoga procedures or practices that cannot be practiced at that certain uh, uh, time due to might be complexity of the existing condition. Otherwise, all can be practiced at all stages. Only thing is when there is a pre-existing complication with body or with any disease, then we have to avoid such things as they can aggravate or they can prolong or they can create another complexity.
Yes, sir. That's the reason I said the guidance of Guru is required.
Yeah, that's what. With because not always the expert guidance is not available.
Medicine at Ayurvedic level, allopathic level, homeopathic level, and yoga, pranayama, right thought, and all those things form part of Ashtanga Yoga.
Yes.
All those things had to be intervened at a different levels, at a different course, at a different what do you say, like extent.
Yes.
I think Suchit Gupta is raising hand.
Yeah.
क्या मैं हिंदी में बोल सकता हूँ? गुड आफ्टरनून
बोलिए
सर। मेरे पिताजी को COPD है सर, क्रोनिक ऑब्स्ट्रक्टिव पल्मोनरी डिजीज। तो अभी वो जो पफ लेते हैं, पफ लेने के बाद उनको जो पेट में सर दिक्कत होता है, पेट में बहुत ज्यादा बर्निंग होता है, जलन होता है। तो मैं उनका अल्ट्रासाउंड वगैरह कराया तो उसमें दिखाया गया कि उनका इंस्टेटेड बाउल लूप्स दिखाया सर। तो उसमें क्या ये COPD भी तो अस्थमा का ही रूप है सर, या अदर डिजीज है?
हाँ।
और वो डॉक्टर को दिखाया सर, तो बोले डॉक्टर सर बोले कि ओइसोफेगस में इन्फेक्शन की वजह से वो फंगल इन्फेक्शन हो गया है, जो ज्यादा स्टेरॉइड लेने की वजह से हो गया है सर। तो उसका क्या अष्टांग वगैरह या कुछ भी कर सकते हैं सर जिससे उनको रिलीफ मिले? प्लीज हेल्प मी सर।
हाँ सुचित जी
सर,
जो मैंने बताया अष्टांग योग ये बेसिक है।
जी
ये बेसिक ये ऐसा मेथड, मैंने जो मेथड बताया ये ऐसा मेथड है कि आपको बहुत सारा डिफिकल्टी से प्रॉब्लम है, आज अष्टांग योग करेंगे, कल सुबह ये डिसॉल्व हो जाएगा, ऐसा नहीं है।
नहीं सर,
अष्टांग योग एक बेसिक फॉर्मेलिटी है एक ह्यूमन बीइंग के लिए। इसके बिना कुछ जिंदगी में आप पा नहीं सकते। आप जानकर इसको फॉलो करेंगे या जाने बिना इसको फॉलो करेंगे, लेकिन आप इसको फॉलो नहीं करेंगे तो जीवन में कुछ भी हासिल नहीं कर सकते। आपको कोई भी प्रॉब्लम आपका बॉडी से या माइंड से हल दूर नहीं होगा। इसको फॉलो करना ही पड़ेगा आपको। तो जो मैंने बताया वो एक बेसिक फॉर्मेलिटी है। आप क्या पूछ रहे, ये बेसिक फॉर्मेलिटी को अप्लाई करके एक स्पेसिफिक डिसीज को इमीडिएटली इसको एडमिनिस्टर करके वो डिसीज को दूर करने का, ऐसे नहीं होता है।
जी सर,
आप समझ में आपको? इसके लिए ये अष्टांग योग एक लॉन्ग प्रोसेस है।
यस सर,
ये लॉन्ग प्रोसेस है। सो आपको क्या करना पड़ेगा, आपके पिताजी को ये अष्टांग योग में आपका डेली लाइफ में अष्टांग योग से अलाइनमेंट में कुछ डिविएशन हो चुका है, तो वो देखना, ये गुरु को देखना है कहाँ पे ये डिविएशन हुआ है और कौन सी फैकल्टी में डिविएशन, या यम में डिविएशन हुआ है या नियम में डिविएशन हुआ है या थॉट प्रोसेस में डिविएशन हुआ है या गोल में डिविएशन हुआ है। एक गुरु को इसी पता चल जाएगा और उनको उसके हिसाब से उनको वो एड्रेस के वो गोल को रीअलाइन कर देंगे और हमारा कॉस्मिक प्रिंसिपल्स के हिसाब से आपके पिताजी अलाइनमेंट कर देंगे, तो वो कॉज ऑफ द डिसीज हल हो जाएगा। तो डिसीज बाकी है उसको आप कोई भी डिसिप्लिन से कुछ भी मेडिसिन ले लीजिए, वो गायब हो जाएगा।
ओके सर, थैंक यू सर, थैंक यू सर, वेरी इंफॉर्मेटिव।
थैंक यू
सतीश जी। और एक क्वेश्चन है, शबनम टेक्स्ट मैसेज, व्हाट्स द डिफरेंस बिटवीन अष्टांग योगा एंड राज योगा? by Shabnam. Satish.
Sabnam ji, ha, Ashtanga Yoga and Raj Yoga. Raj Yoga is part of Ashtanga Yoga. The first four faculties of Ashtanga Yoga is the last four faculty of Ashtanga Yoga is called as Raj Yoga. The first, the last four, that is after asana and pranayama, pratyahara, dhyanam, dharana, samadhi. These four are called as Raja Yoga, Raj Yoga. And or Raja Yoga or Antaranga Yoga. The first four limbs are called as Bahiranga Yoga. The last four limbs are called as Antaranga Yoga. So you can practice the last four limbs anytime, anywhere, like I said to you, like even while traveling, while sleeping, all those things, it can happen. While sleeping, while traveling, while eating, 24/7, the next four, the Raja Yoga can happen. Alignment, like I said, yoga is, the word yoga is yujate iti yoga. So now we all are sitting and discussing on a topic that itself is yoga. So Raja Yoga, it's the right vision, and with the right vision, when you're doing Raja Yoga, it can be practiced 24/7. The first four needs physical time and various other process. Whereas in the next four, that is the Raja Yoga, can be followed by anyone at any point in time, irrespective of whether physical purity or impurity, whether boundaries, physical boundaries, nothing is going to limit or stop the practitioner of Raja Yoga. That's the reason it is called as Raja Yoga. A Raja can be stopped by anyone. So that is how it is Raja Yoga. Once you start practicing Raja Yoga, no one can stop you. Got it, Shabnamji?
Thank you. She has message. Thank you. Grateful. Yes, sir.
Welcome.
Thank you, Satish ji, for joining us and sharing insights into yoga.
Thank you, sir. It was pleasure. It was thanks for the Shri Institutes for giving me an opportunity to explain Ashtanga Yoga and promote this. I think it's a divine blessing that it has given an opportunity to bring out this and divine and cosmic issue to the group. Thank you very much.
Thank you, sir, once again for joining and sharing valuable insights. And we look forward for your presentations and participation, even in future events. Sir.
Definitely, sir. My pleasure.
Thank you, sir.
Thank you. Bye.
After listening to wonderful session by Satish ji, we will move on to our next speaker. Now, I would like to invite Dr. Pratish K. R. Kiran, MBBS, MD, DGM, Associate Professor, Department of Community Health, Convener of Disaster Management Unit, Faculty at the Department of Medical Education, and Coordinator, Senior Citizen Health Service at St. John's Medical College, Bangalore, to take over for the session on aging and health and related to the theme. We welcome you, sir, once again. Pratish ji.
Thank you, Dr. Ravindra. Good morning to all the participants at this particular symposium on allergies and respiratory disorders. I will be discussing about some aspects with regard to elderly. What are some of the problems that are faced by the elderly, and as to why it is important for us to remember that as one grows older, there are some changes that occur in the body, as a result of which we need to ensure that care of older persons is done in a better fashion. So if we look at the definition of an older person, as far as the United Nations is concerned, an older person is defined as somebody who is more than 65 years of age. But in the Indian context, we have what is called the National Policy on Older Persons. And in the Indian context, 60 years and above is taken as the definition of a person who is considered as an older person or an elderly person. We further categorize elderly into young old, old, and oldest old. The young old being 60 to 69 years, the old being 70 to 79 years, and those above 80 years being called the oldest old. As far as India and the world is concerned, the number of older people is increasing, right? So as of 2020, in India, we have close to around 150 million people who are elderly as such. And this is, almost around 9% of our total population. So even the number of
Sorry
people.
to interrupt, sir. The slides
Yes.
are not moving, sir. We are still on the first slide.
You are still on the first slide. Okay. I can see the slides moving. One moment. Right.
Yeah, now we are on who are elderly slides.
Who are elderly. Okay.
Yeah,
Are you able to
population
see it
slide.
now?
Population slides.
Yes. So the number of elderly as such are increasing all over the world as well as in India. And in India, we have close to around 150 million people who are considered as elderly, who are 60 plus as far as age is concerned. And this constitutes close to around 8%, 9% of our total population of the country. Are you able to see the next slide?
Yes, sir.
Wonderful. So even the number of individuals who are aged 80 years and over, this number is also increasing. And by the year 2050, we are projected to have close to around 37 million people who would be aged 80 years and above. Right? Currently, the life expectancy of an older person in our country is close to around 70 years. But by the year 2050, we would have close to around 37 million people who would be aged above the age of 80 years in our country. So if you look at the current scenario is that the majority of the population is aged less than 30. But we have a population which is also quite large who are aged 60 years and above. And this population has not been given a very serious consideration. Most of the focus of national programs, most of the focus of the programs of the government are on children as well as the youth, and not much of focus as far as programs are concerned has been given to the elderly. There is a rapid change in the social scenario. So we have more and more nuclear families who are actually there in our country. The joint family system and the the three generation family system, where parents possibly are part of the family, that is slowly coming down as far as the country is concerned. And we have a lot of elderly people who are staying alone, or who are actually staying with other community members and not necessarily their own family members. There is also a decrease in physical ability and economic instability as far as the elderly are concerned. So as one grows older, due to the various changes that occur in the elderly, people become dependent on the others due to problems that they have. And also in our setting, given that most of our elderly are in rural areas, there is a lot of economic instability because they don't have much of savings, and they don't have much of pensions that actually come across in this particular age group. We have the aging population because fertility trends are down. So earlier on, we would have multiple number of children in the family, but currently with the fertility rates coming down due to various reasons, as well as the mortality rates decreasing. So there is a better health of individuals even in older age. With technology, people are living longer, and survival is increasing, and due to all this there is a aging population that is also increasing. And with this aging population, there are components of socioeconomic pressures on governments, on individuals, as well as increasing healthcare expenditures, and decreasing savings levels, which possibly are faced by older individuals. So if we look at the total population as far as our country is concerned in rural and urban areas, we have a larger proportion of elderly in rural India, and a slightly lesser proportion in urban India. And in both the settings, the females outnumber the males. The dependency ratio has been increasing. So we have a larger number of older people. You can see the line in red, which is going up, and the number of older people as compared to the number of people aged 15 to 45 years. These numbers also are increasing as compared to the younger population who is earning, who these older people would be dependent on, which is on the decline. So these are the age gender pyramids, which you can see, which show that by 2026 we would have a sizable population of older people as compared to what it was in 2001. So you can see the change of the proportion of younger individuals, which forms the base of the pyramid. So in 2001 as such, this particular base of the pyramid, which comprises of younger individuals, was a much bigger chunk. But by 2026, due to the reasons which I mentioned earlier of decreasing fertility as well as decreasing mortality and increasing life expectancy, we would have larger number of older individuals forming the population pyramid in our country. So if we look at this particular study, which was done in the year 1996 approximately, it's a very old study. At that point in time itself, we had close to around 75% of elderly persons in that particular study who were from rural areas of the country. At that point in time, 48% in that study, were women. Though we actually see in the real life scenario that there are more women as compared to men who are above the age of 60 years. So the sex ratio of women is to men is probably only more in that particular age group because of premature death among males, as well as the number of women who possibly outlive men due to various reasons. 73% of that population was illiterate and dependent. 66% of them were below the poverty line, and 66% were in a vulnerable situation and without sufficient food. So this was the status of the elderly in that particular study. So as far as elderly are concerned, there are a lot of changes that occur as far as the older person is concerned. There are changes in body composition. There is a discrepancy in energy production and utilization as far as the older person is concerned. There is a homeostatic dysregulation. That is, the various systems of the body which are possibly in balance in younger age groups slowly start getting imbalanced. So we have changes that occur, in the kidneys, changes that occur in the GI system, changes that occur in the respiratory system, changes that occur in the central nervous system, as a result of which the older person starts developing various problems. There is what we call neuro degeneration as a person grows older. So the functioning of the nervous system definitely decreases as a person ages, and all of these lead to what we call frailty and various geriatric syndromes. So older people suffer from various problems. They are not necessarily disease conditions alone, but sometimes a combination of problems which is actually seen in older people. So there is anorexia and malnutrition. There are gait disorders as well as falls that may actually occur. Disability of the older person due to various conditions such as a problem in vision, a problem in hearing, a problem in mobility, various comorbidities as well as increased disease susceptibility which can occur in older people, urinary incontinence, decubitus ulcers, especially in individuals who are bedridden, sleep disorders. So individuals who sleep lesser due to various reasons. It could be due to mental health issues. It could be just due to problems such as urination in the night itself, which keeps them awake. So all of these leading to sleep disorders. Delirium, which is a sudden change in the mental status of the individual, which is more of a confusional state, that could be signs of an underlying infection which is quietly emerging in the older person. And cognition impairment, that is issues with regard to memory, issues with regard to mental status and thinking, which decrease as the person grows older. So all of these are issues which we call geriatric syndromes, because they are not necessarily present in a condition, but there may be multiple such issues that are present, which are seen in an older person, which point out to certain disease conditions. So as far as elderly are concerned, there are physical problems, there are psychological problems, social problems, and economic problems. And as far as our population is concerned, we have elderly who suffer from communicable and non-communicable diseases, and issues that are not just physical, but largely social and economic in nature. So there was an independent commission that was formed sometime in the year 1982, and this particular commission did a study looking at health status of the elderly, and they found that close to around 88% of older persons reported some form of visual impairment. So the visual impairment was possibly due to a cataract or due to a simple refractive error, which could be corrected with spectacles, but which was not corrected in these individuals at that point in time. 40% of them reported joints or muscles disorders, so pain in the knee, pain in the various parts of the body. So aches and pains, which form a very, very common complaint as far as older people are concerned. Close to around 20% of them reported a neurological complaint, primarily a stroke or a weakness as far as the body was concerned, or a burning sensation and some amount of lack of sensation in the feet, which is commonly seen in diabetics. 17.4% of them reported a cardiovascular disease, so some sort of a heart related issue. 16.1% reported a respiratory disorder. Now, this is a very important finding as far as this particular day's session is concerned. So respiratory issues formed almost around 16% of reported physical problems, right? It is not unreported physical problems. And these respiratory disorders range from COPD to bronchial asthma to lung cancers, which are also quite common in older persons. 13.3% of them reported skin conditions, 9% reported GI tract problems, primarily constipation, 8.5% reported psychiatric issues. Right now, this is actually a very, very low number, but we are aware of the fact that older people can suffer from mental health issues, primarily depression, and close to around 30 to 35% of older persons who actually come across to the hospital have mental health issues, and this number could very well be close to around 50% as far as community elderly are concerned. These psychiatric problems being due to multiple issues that we mentioned in the past slide, being social issues, economic issues, as well as issues related to elder abuse. 3.5% of them reported genitourinary problems, and 8.2% of them reported a hearing loss. So these were the various physical problems that were actually reported in this particular study. We have come a long way from this particular study, because it was way back in 1982. But currently the situation is such that visual impairment has decreased due to various corrective surgeries that are possible in the elderly. We also have a good reach of the blindness control program, which is a national program in our country, and as a result of which elderly have corrective aids, that is spectacles that are actually provided in various settings, both in the rural and the urban areas. And we have more and more elderly reporting cardiovascular diseases, as well as respiratory disorders, given the fact that there is more reach as far as diagnosis and treatment is concerned, and there is possibly facilities that are better available in our primary healthcare centers, which were not so much available at that point in time way back in the 1980s. So in a study done in Bangalore, the prevalence of any medical problem among 65 plus, so the prevalence of one particular problem at least was close to around 85% of elderly who reported this particular issue, and close to around 58% of them reported disability. Right, so this was a study that was done in urban Bangalore. The prevalence of hypertension in the elderly was as high as 65%, both detected and undetected hypertension. Though I would probably put this particular study as an overestimate. The prevalence of hypertension in the elderly is close to around 40%, and maybe the sampling methodology in that particular study was not necessarily right. But in that particular study which was done, it was close to 65%. The prevalence of diabetes in the elderly, both reported and newly detected, was close to 25+%. And this is actually the estimate of diabetes in the elderly. It's actually close to around 30% in the elderly population in our country. And 13 to 25% of the elderly expected to have depressive disorders, as far as that particular study was concerned. So the numbers are close to around 30% of elderly people, like I mentioned earlier, with numbers going up to around 50% of older persons having mild depression in the community itself. So these are some of the physical problems that older people may actually face. There are eye and ear changes that actually occur. So there is a denaturation of the lens protein. So the lens in the eyes undergoes change, as a result of which there is cataract that develops, and which results in low vision and blindness in individuals. There is a loss of accommodation that is, I mean, the changes, in the eye musculature, as a result of which older people are not able to read, or are not able to perform tasks, like taking out stones, from rice or dal. And such individuals again suffer from low vision, which can be corrected by provision of spectacles. Lax eyelids and reduced tearing, lacrimation. So the eyelids, become a little weak, either due to I mean a stroke, or due to an older person itself losing the strength of the muscles of the eye, and as a result of that there is a little drooping of the eyelids as well as dry eyes. So the condition called xerosis, which older people complain of. They complain of burning of the eyes as well as dry eyes. There is a change in the retina, right? So retinal degeneration can occur, as a result of which there is some amount of blindness that can actually occur in older people. Retinal degeneration can occur due to multiple reasons, the commonest reasons being uncontrolled diabetes and uncontrolled hypertension, which lead to some amount of changes in the retina in older people. And lastly, the degeneration of cochlear hair cells. So degeneration of the apparatus in the ear, which leads to some amount of hearing impairment. So when we talk to older people, many a times we find that they are not able to hear us clearly, and this particular hearing can be normalized through the provision of hearing aids. Osteoporosis, a weakening of the bones, can occur more so in women, especially post menopause. And we have also individuals who have calcium as well as vitamin D deficiency in older age groups, more so due to a lack of exposure to sunlight. So they prefer to stay indoors without necessarily wanting to go outside and exposed to sunlight. Also due to sedentary lifestyle, a lack of physical activity, due to smoking, alcohol consumption, as well as caffeine excess. Calcium and vitamin D supplementation is an important component that needs to be included in our management of the elderly. So we need to ensure that older people are encouraged to do regular walks, to be able to perform some amount of muscle strengthening exercises in order to be able to ensure that they don't have falls. And smoking as well as alcohol consumption needs to be discouraged as far as older people are concerned. A very good intervention would be simple sunlight exposure for at least 15 minutes a day for at least 3 times in a week. This is a very simple measure that can be told to the elderly in order to be able to ensure that there is good vitamin D which is actually generated in older people through simple exposure to sunlight. Depression, I told you, is a huge issue, and we have close to around 50% depression which can occur in the community, like I mentioned earlier. Hospital-based studies have shown close to around 26 to 30% of older people who come across the hospital suffering from depression. And most of the issues with regard to depression are due to a comorbidity. So they may have issues such as hypertension, diabetes, which lead to a lot of economic issues in the older person, as well as issues of problems due to these health conditions. So due to which they actually suffer from mental health issues also. Very important for us to realize that this condition is under recognized and inadequately treated. So many a times if we don't identify this problem, it can lead to decreased quality of life as well as increased problems as far as older people are concerned. There are certain medicines also that can cause depression, and we need to look out for the possibility of medication induced depression as far as older people are concerned. So the presence of at least one major symptom and two minor symptoms in the previous 2 weeks, symptoms of low mood, a loss of interest, easy fatigability, and minor symptoms of reduced concentration and attention, reduced self-esteem, reduced self-confidence, ideas of guilt and unworthiness, bleak and pessimistic views of the future, ideas or acts of self-harm or suicide, disturbed sleep, diminished appetite. So all of these are symptoms, which may point out towards possible depression being, present in an older person. Dementia, a decline in memory, a decline in understanding or activity, of an individual. This is also something that is seen as far as an older person is concerned. Urinary incontinence, the problems, with regard to urination, either, what we call stress incontinence, seen due to, muscle weakness, more so in females, urge incontinence, right? So a person, wanting to suddenly pass urine but unable to, hold the urine back and is forced to immediately, pass urine. Or overflow incontinence, right, due to certain bladder issues, bladder weakness as such, as one grows older. So these are, problems that can be seen in the older person, and, which may cause what we call an impairment in the activities of daily living. Falls may be, common in the older person. And these could be due to central nervous issues. It could be due to sudden hypoglycemia, especially in diabetics, and postural hypertension. So postural hypotension, which occurs largely, due to certain drugs which are, given, which may suddenly, cause a drop in the, blood pressure. We see this, usually in, diuretics. So certain blood pressure medicines, which cause excessive urination and sudden drop in blood pressure, as well as in peripheral neuropathy. So in diabetes, there is, a loss of sensation of, the person, in the feet. And this, may actually make the person not realize that, he or she is actually stepping on, something which may, actually cause the person to trip and fall. Other issues such as poor lighting, uneven floors, cluttering, within the house, certain, defective flooring or, staircases, defective footwear, not using a walking aid. Many people, even though they find it difficult to walk, they may not want to use a walking stick. So all of these kind of issues, as well as health issues such as joint pains, problems more often with the knees, and the weakness of the lower limbs, epilepsy, as well as syncope, sudden dizziness and giddiness, causing the person to actually have a fall. These also may be issues that may be faced in older people, which need to be identified and treated in order to be able to prevent a fall. Cancers are a common issue, more so in older people, and men have a risk close to around 15 times greater risk, and women 8 times a greater risk of having cancer above the age of 60 years as compared to younger age group. Lung and prostate cancer are the more common cancers in males, whereas in females it is cancer of the breast, followed by cancer of the cervix and the ovary. Skin conditions, so senile wrinkles, scaly lesions, as well as just simple dryness of the skin. So all of these are I think there's a mic that is switched on. Can I request
Yes,
whoever
sir.
is not presenting to mute themselves?
Yes, sir. It's muted now, sir. Please
Okay,
continue. Sorry
thank
for
you. No, not at all, sir. So dryness of the skin is a very, very common condition in old age, and they complain of of itching on the skin, which can be addressed through just simple application of coconut oil, which can reduce that particular itching in old age. Malnutrition in the elderly. So we have both. I mean, people who are underweight as well as people who are obese. So both problems can occur in the elderly, and the number of individuals who are underweight are close to around 50%, and more so in the low income group. So malnutrition is largely due to economic insufficiency, but can also result in individuals who have a poor appetite. So they have I mean a decrease in appetite as they grow older. Inability to cook nutritious meals. So especially more so in elderly people who are living alone, and sometimes in case there is a neglect or abuse of the older person, even in conditions where they are living with other family members. A difficulty in mastication, a difficulty to bite because of the lack of teeth, or issues with regard to the tongue. So all of these can result in malnutrition, especially undernutrition as far as older people are concerned. Premature death is an issue, and premature death, that is dying well before the usual time of death. The life expectancy being around 70 years, but death occurring even before that. That is quite high, especially seen in middle and low income countries. It is also seen in our country, and some of the major causes being either cardiac issues, or a stroke, as well as tuberculosis and lower respiratory infections, right? So all of these are leading causes of premature death even in our country. Disability that occurs, especially due to either low vision, or hearing issues, or osteoarthritis, or due to a stroke, or due to other CNS conditions such as Parkinson's. So all of these are seen more among older people in again middle and low income countries. Psychological problems. So older people who have mental health issues, largely due to shortage of money, I mean difficulty in passing time, widowhood. So we have a large number of elder people who lose their life partners, and when that happens, they suddenly start feeling lonely, and suddenly start feeling very insecure, and develop also the fear of death, especially when they actually hear of other people in their age group suddenly dying. They suddenly start developing a fear of death, as a result of which they may also go into depression. Adaptation to a new lifestyle. So many a times people may be forced to move from the rural areas to the urban areas, and they may lose the ability to be able to socially interact. They may just be within the house itself. Sometimes they may actually have children living far away from where they are living, and as a result of which they are either living alone or in old age homes. So all of these become challenges as far as a new lifestyle is concerned, and adapting to the new lifestyle as such may cause certain mental health issues. A feeling of social neglect, not being able to interact with people around, not being able to speak to somebody. So these are also psychosocial problems that can actually develop in older people. So early symptoms of psychosocial issues, a lack of sleep, a change in sleep patterns, probably not sleeping at night, but sleeping during the day, low interest, feeling some sort of guilt, right? So the person says, feel like I'm a burden to somebody else. The lack of energy, low concentration, decreased appetite, as well as suicidal thoughts, ideations, right? So people saying, I feel my time has come, I don't want to stay on this earth for very long. So all of these are symptoms which need to be picked up early, and individuals need to be helped in various ways, both medically as well as through counseling, as far as these problems are concerned. Social problems, right? So dependency, insecurity, elder abuse as such, these are issues that need to be picked up. Elder abuse is something that needs to be picked up very early on. It's very difficult to be able to pick up elder abuse, given the fact that many people do not report elder abuse. But elder abuse could be even physical abuse, where older people are inflicted physical harm. It may be psychological abuse, where people may have some sort of a mental torture. Financial abuse, where we have seen that older people get exploited, either of their property or of their money. And sometimes in very remote circumstances, even sexual abuse, where older people are subjected to some amount of abuse by other individuals in the sexual form. So it is very important to be able to pick up elder abuse and ensure that these problems are addressed early, sometimes even through legal recourse. Economic issues. We have close to around 40% of the elderly who are working in our country, who have a very inadequate source of income, and they depend totally on their children for their daily needs. So it is important to be able to try and address some of these issues. The government of India tries and helps through what we call old age pensions and widow pensions, and disability pensions. But these amounts that are actually provided are very small amounts, and may not be very useful or helpful for older individuals to be able to address their economic issues. It is important to be able to plan early, as well as to work with families of older people, in order to be able to ensure that these economic issues are addressed well in advance. So these are some of the preventive measures. We have primary prevention that is there in terms of developing good habits with regard to nutrition, with regard to physical activity, with regard to giving up smoking or alcohol, ensuring that people go in for regular health checkups, right? Immunization is an important component that can be looked at. We have more and more number of older individuals who are now immunized against certain conditions. Osteoporosis prevention through vitamin D supplementation, as well as sunlight exposure, and hip protector devices. So a hip fracture is a very common condition among older individuals who have osteoporosis and who actually suffer a fall. So that kind of a hip fracture sometimes can be protected through what we call hip protector devices, which are available in the market. Injury prevention, I mentioned about good lighting being required, ensuring that there is no obstacles and the floor is even. The use of what we call grab rails, the use of good footwear, as well as ensuring that the bathroom is safe, right? So slip proof tiles, right? So anti slip tiles in the bathroom, as well as ensuring that surfaces are not wet when an older person accesses the bathroom, as well as good lighting. These are important for fall and injury prevention. So early screening for blood pressure, so at least ensuring that once a year there is screening for blood pressure, and in case the person is hypertensive, at least once in 2 to 3 months checking for blood pressure, an annual dental checkup being done, uh, diabetes checks at least every 3 years for screening, and in case the person is suffering from diabetes, once in every 3 months at least being done, looking for lipid levels every 5 years at least in normal individuals, and those who are diabetics or who have any kind of stroke or other cardiovascular diseases, at least once in a year. Vision testing, including glaucoma testing every 2 years, and at least once a year in case the person is either a hypertensive or a diabetic, and periodic hearing evaluation at least once a year after the age of 60. So these are important aspects to be able to pick up an illness early on and treat on time. Stool tests to be able to look for blood in the stools, done once a year. A mammography to be able to pick up breast cancer, so this is recommended every 2 years between the age of 50 and 74. A pap smear is recommended every 3 years up to the age of 65 years from 45 years onwards, and a bone mineral density, that's to be able to look for osteoporosis once every 2 to 3 years beyond the age of 60 years. Uh, Looking at caregiver support as well as rehabilitation of the elderly, this is a very important component, and the rehabilitation as such looks at various individuals being a part of the team, right? So it involves doctors, nurses, physiotherapists, psychiatrists, dietitians, nurses, social workers, and the families of individuals, in order to be able to ensure that individuals have a good quality of life. So these are some of the bits as far as primary, secondary, and tertiary prevention of various problems in the elderly is concerned. So I will skip the next few slides in terms of schemes that are available. These are I mean government based schemes, and they are available for I mean individuals to be able to look at. As far as the internet is concerned, it is freely available on the internet itself. But I'd like to end my session looking at these two individuals. One individual being Dr. Abdul Kalam, a former president, and the other individual being Fauja Singh, right? So Fauja Singh was a 100-year-old gentleman who completed the marathon, right, in Canada, in Toronto, and at the age of 100 to be able to complete the 10-mile marathon is a huge achievement, especially given so that it is a 100-year-old individual who is actually running that particular marathon. So what is very important is that if you are healthy, age is just a number, right? So it is not about being 60, 80 or 100, but being healthy at that particular age is most important. We had a theme by the United Nations a few years back, which said, do not add years to life, but life to years, right? So do not look at just living up to an old age, but living healthily as far as that particular aging is concerned. So with this, I would like to thank the organizers of today's session for the opportunity to be a part of this particular session, and I wish all of you all very good deliberations and a wonderful remainder of the CME of today's session. All the best, and I throw it open now to any questions, if any.
Thank you, Pratishji, for the wonderful presentation. You have touched upon every aspect of geriatrics. That is, old age is how the old age people or the senior citizens face different kind of situations and various situations they go through, medical conditions, the kind of possible treatments at different levels. It was very insightful and very helpful for all of us. Participants, if you have any queries, you can raise your hand or you can unmute yourself or you can put in chat box so that we can take up the queries. Or if you have any comments also, please go ahead. Yeah, Mary ma'am.
Hi, sir. So you have done a great justice to the topic, sir. So I learned everything, sir. No doubts, but heartfelt congratulations, sir. Done with really good job. So I learned so much, sir. Lot of takeaway, and I jot down lot of points. Like you really mastered the geriatric health. Like that, I can tell, sir. So I learned lots, sir. All the best, sir, and have
Thank
a
you. Thank you.
wonderful.
Mary.
All the best for your life also, sir.
Thank you. Thank you.
Wonderful presentation, sir. Wonderful. You're really done 200% justice to the
Thank you very much.
topic, yeah, because you have really touched on everything. No doubts we have. So
Wonderful.
you're really, I feel proud that I invited you here, sir. So yes.
Thank you, Mary. Thank you for the
Thank you very
opportunity.
much. Future sessions, we love to hear you once more, sir.
Thank you. Thank you.
Love to hear you once more, sir.
Certainly, look forward, to being part of, any further deliberations also.
Okay. All the best, sir, for your next session. All the best for your life also, sir.
Thank you, Mary.
There is a lot of appreciation, sir, in the chat box.
Thank you, Dr. Ravindra.
Bharti from Dr. Bahadur, Dr. Jyotsna, excellent presentation.
Wonderful. Thank you, Dr. Ravindra.
There are no clarifications, but appreciations are there. So thank you very much, sir. Once again, I know being doctors, it's a very tough time to take out time for the sessions and for accepting our invitation and joining us in a very short time and covering a great insight and adding value to the webinar, sir. Thank you. We thank you once again on behalf of Sri Holistic Health Foundation India and Sri Research Institute Center for Arts, Sciences and Wellbeing, and all the participants. Thank you very much for joining us and look forward for your presentations and participation in even in future events.
Thank you, sir. Thank you very much.
Congratulations.
Have a nice day.
Have a great day. After the great insights which was provided by Dr. Pratishji, now we will move on to our next speaker. Divya, are you ready with the presentation?
Yes, sir.
Now we have with us Srimati D. Divya Bharti. She is nurse and also counseling psychologist. So she will be presenting on hypersensitivity, contact dermatitis, and allergy proofing, the hope and community. Over to you, Divya. You can unmute and share PPT. You can also switch on your video. Yeah, your PPT is visible, ma. You can start. We can't hear you, ma.
Hello.
Yeah, can you increase the volume to max? Yeah, you can unmute yourself, ma. Try sharing again.
Sir, now my voice is audible, sir?
Ah, yes, ma.
Yes.
Try sharing your PPT.
Yes. Sir, is it visible?
Yes, ma. You can switch on your video also.
Okay. Am I visible, sir?
Yes, ma. Yeah, continue. Over to you.
Good evening, everyone. Today I'm going to share with you a very simple thing. We are thinking that it is very simple disorder, but in everyone's life we are facing this allergy. So, in according to my knowledge, I would like to share some things with you. And first, I would like to tell about hypersensitivity. So, what is the meaning of hypersensitivity? So, we know all allergy. So, hypersensitivity is nothing but allergy. So, it is an excessive or abnormal sensitivity to a substance. So, a person who is having severe allergic reaction, who is suffering with that itching sensation and all, it will be there. So, it will be due to there is so many causes will be there due to drugs or anything. The following slides we can continue that. So, first, what is the meaning of hypersensitivity? Means it is an excessive sensitivity or abnormal sensitivity to a substance. So here I'm showing two definitions here. So first one is that is according to pathology. A pathology students what they are telling means hypersensitivity refers to undesirable reactions produced by the normal immune system, including allergies and autoimmunity. They are usually referred to as an overreaction of the immune system, and these reactions may be damaging and uncomfortable. So here, what will be there? What they are telling means there is a undesirable reaction. Okay, so in our immunity system, normal immunity system, it will show some symptoms. So that we can see in the form of allergy. So microbiology student, what they are telling means hypersensitivity is called as allergy. So here hypersensitivity is an exaggerated immune response that results in tissue damage in a sensitized individual on second or subsequent contact with a specific antigen. Antigens which can cause allergic symptoms are referred to as allergens. So these are the terms said by pathologist and microbiologist. So coming to classification. So what are the classifications? There is two classifications is there. First classification is based on the time required for the appearance of clinical reactions. The hypersensitivity reactions may be classified into two types. First one, immediate hypersensitivity. Second one, delayed hypersensitivity. Immediate hypersensitivity means suddenly, immediately we are that hypersensitivity will show. That is mainly due to the antibody mediated. So antibodies will get respond to these allergic reaction. So in immediate hypersensitivity, there is certain types, subtypes will be there. So that is in the form of there is 5 subtypes will be there. That is first one anaphylaxis, second one atopy, third one antibody mediated cell damage, fourth one Arthur's phenomenon, fifth one serum sickness. So next one, delayed hypersensitivity. So delayed hypersensitivity, there is the allergic reaction will be formed in the T cells. So T cell mediated, it is called as. So here in the form of what this hypersensitivity show in the body means infection and contact dermatitis type. So we know tuberculin test for a tuberculosis positive symptoms, the test will be doing in a hospital setting. So whomever familiar with this test, you can understand what is this. And second classification is Coombs and gel classified hypersensitivity reactions. So it is two scientists, they are this classification given into four classifications. First one, type 1. Type 1 is called as anaphylactic or immunoglobulin E or regain dependent. And the type 2 classification is cytolytic and cytotoxic. Type 3 is immune complex diseases. And type 4 is delayed or cell mediated hypersensitivity. And we will see the difference between the immediate hypersensitivity and delayed hypersensitivity. So here immediate hypersensitivity we talk here. So based on the time required for the appearance of clinical reactions, we divided these classifications into two types: immediate hypersensitivity and delayed hypersensitivity. So this is most common form of allergic reaction found in our body. So that's why today I would like to talk about these two. So in mostly I would like to focus on the contact dermatitis latter. So now we are going to understand what is immediate hypersensitivity and what is delayed hypersensitivity. So here immediate hypersensitivity, there is onset of reaction will be how it will be means onset how the occurrence of the allergy will be forming. Based on that we can classify the immediate hypersensitivity and delayed hypersensitivity. So immediate hypersensitivity there is appears within few minutes. So immediately means after the dust particle if pour on our skin, immediately that reaction will be formed. So that is called as immediate hypersensitivity. And delayed hypersensitivity. Here delay there is means frequent contact of that substance for several times, it will leads to a allergic reaction. So that is within 1 to 3 days of continuous contact of that substance leads to delayed hypersensitivity. Next, basic lesion. So what is how the form of lesions will be there? So in medical, the physicians, they will say that these are the forms. Means if you see your case recorder, then you can find these terms on that your case sheet. So here in basic lesions in immediate hypersensitivity, there is a form of exudation will be there. So here there is increased capillary permeability. So capillaries means throughout our skin there is so many arteries will be there, veins will be there. So arteries, veins, the smallest branch of arteries and veins is called as capillaries. So there is if the lesion means there is increasing of capillary permeability will be increased, then there is a contraction of smooth muscles. So that smooth muscles, whatever present on our skin, that will get a contraction. You know very well about contraction, no need to explain about it. So then delayed hypersensitivity. So in delayed hypersensitivity, how we are seeing means what is the physiology undergoing there? There is induration due to aggression of cell infiltrates. So there is no contraction of smooth muscles will be there. So there is a contraction will be not there. So that is the delayed hypersensitivity. And skin test. So through what test we can understand that is immediate hypersensitivity means the test name is called as Wayland flare, and delayed hypersensitivity is induration. So by these tests, we can assess that immediate hypersensitivity and delayed hypersensitivity and desensitization. So here in immediate hypersensitivity, it is easy but short-lived, and in delayed hypersensitivity, difficult but not easy. So here I told you previously. So first in the first classification, there is in delayed hypersensitivity, one of the classification is contact dermatitis. So now we are looking through this contact dermatitis. So what is contact dermatitis means? It is a, you are seeing in this picture, there is a red rash will be there. So this rash is called as contact dermatitis. So this how this rash will getting due to substances or due to substances that may be which is uh, in any form. So here this thing, what is this dermatitis is there? So that is it will be a simple rash, but it is not that much life threatening, but it will make us to very uncomfortable to do our routine. So what are the types of allergies? So we are talking about allergies. What is these allergies? What are those types? So there is food allergy will be there. So due to food, so many people there means in daily we are consuming so many foods, but some of the persons is they are having a allergy to particular food like peanuts or mango. So that food allergy will be there. If you are having that food allergy, you have to avoid that. Then what is drug allergy? So drug allergy means due to consume of certain medicines, it will make you to get allergy, form a allergy within your body. That is drug allergy. And insect sting allergy. So what is insect sting allergy? So biting of a insect, at that time that sting will be inside your skin. So if you are not removing that, not noticed that, then you will get certain allergy. So that is insect sting allergy. So that bite will be that will come and that will biting you and it will go. Then allergy will form within your skin. Then latex allergy. So if you are using continuously gloves and all, then you will feel some allergic reaction. And a mold allergy, and a pet allergy, and pollen allergy, and dust mites. So mites means that there is certain insects will be there. Due to insects also, you feel some allergy. So these are the types of allergies. And types of eczema. You know very well that eczema, so many people they are getting eczema in their lifetime. So there is certain types will be there, that is atopic dermatitis and dihydrotic dermatitis and contact dermatitis and neurodermatitis and nummular dermatitis and seborrheic dermatitis and statitis dermatitis. So these are the types of eczema. I'm not going into details about it. Just look the symptoms, how it will be looking on the skin, how the skin is getting, means the normal abnormal skin we can are able to understand on this by this picture. So now coming to causes of contact dermatitis. So what are the reasons why we are getting these contact dermatitis? Means a substance exposed to skin triggers an allergic reaction. So there is two types of causes will be there. So that is according to the duration of intensity. So first one is irritant contact dermatitis and second one is allergic contact dermatitis. So irritant contact dermatitis, what it is means a painful rash tends to come on quickly in response to an irritating substance. So there is the painful rash will be settled on your skin. So due to what the painful rash will come? Due to solvents, due to rubbing alcohol. Means we are using spirit, no? So that that alcohol, rubbing alcohol and bleach and detergents, shampoos, airborne substances like sawdust or wool dust, and plants and fertilizers and pesticides. So due to these things, getting allergy. Which allergy? That is irritant contact dermatitis. Second one, allergic contact dermatitis. So allergy, this allergic in this, if body has an allergic reaction to a substance that it doesn't like, it can take several days after exposure to substance. So so due to several times of exposure, you will get allergic contact dermatitis. So due to what are those exposing, what are those substances? Means jewelry, buckles, medications like oral or antibiotic creams, and perfumes, cosmetics, formaldehyde, cosmetics, deodorants, hair dyes, body washes, plants, especially poison ivy, one of the plant will be there. Due to that plant also, certain individuals getting this allergy, and certain individuals have allergy to mango also, and insecticides and sunscreen lotions. Coming to risk factors, so healthcare and dental employees. So who all are people having the risk of getting this contact dermatitis? So healthcare and dental employees, metal workers, construction workers, hairdressers, cosmetologists, auto mechanics, swimmers, cleaners, gardeners, and agricultural workers, cooks, and others who work with the food. What are the symptoms? What are the signs and symptoms? So after getting allergy, what are the symptoms developed in our body? So there is a red rash will be appearing. There may be itching will be there. Dry, cracked, scaly skin will be there. Stinging will be there. Blisters, oozing and crusting, and swelling, burning or tenderness. So different substances will show different symptoms. Not all the symptoms will be present in certain individual. This is a very common symptoms that in different individual they may getting different symptoms, but most of them having these symptoms are similar. So here you're seeing on the picture there is blisters will be there in the right hand side. So like this formation will be present on the body. And here one more in the hand there is a forming of these things. So what are the complications? So here there is majorly three complications will be arriving. First one, urticaria, angioedema, and anaphylaxis. So here you're looking here on the screen, there is one lady, there is full of edema will be present on her eyes. So that is called as angioedema. So complete the swelling will be present on near her around eyes. And anaphylaxis. Anaphylaxis means it is a life-threatening situation. So means if a person is continuously, if rash is coming or some if, some active will be formation will be started at the time, what will be happening? The person is continuously rubbing or scratching his skin. It may go into the internal, means internally it will be getting some issues, means that capillaries from capillaries it will be reached to your total entire body, and it will cause a harm to, means systematically to blood. The infection carrying pathogens may enter into your complete body. So due to that, what will be happening? There is life-threatening situation will be getting. Why? Because we don't know. Our blood will be circulated overall body from head to toe. So if it is settled on brain, what will be happening? Meningitis like that, some issues will come. Settled in heart, some heart issues. So like that, life-threatening situation will come. And here you are seeing one boy is settled in some symptoms on his chest and abdomen, that is called as urticaria. So complete overall body, there is formation will be happen. So these are the complications. So we should not take that much easy that contact dermatitis, what happened, dust allergy only, no, we should not take it easy. So it is very, we have to take prevention previous itself. So what are the preventive measures? So what preventions we have to take means avoid irritants and allergens. So whatever irritants will be there, allergens will be there, that we have to avoid. So whatever the substances which will irritate our skin, we should avoid those substances, and we should not touch those allergen irritants. So wash your skin. So we have to wash the hands carefully. So dust, if we are exposed to a dust or any plants, if we touch some substances or things, then immediately we have to wash our hands and wear protective clothing or gloves. So when we are using any household work, clean toilet or wash basin or kitchen work doing, if that a particular substance is allergic to your body, if you know previously, you have to compulsory use the gloves and use moisturizers. So if if you are getting that rash or you are getting some uncomfortable on your skin, immediately you have to apply some lotions like aloe vera gel, any lotions you can use it, and apply a barrier cream. So, like over the counter skin creams will be available on the market. Then you can apply on your skin and take care around the pets. So, mm, so here what will be happening around your home? There is some chemicals will be there. We don't know. Pets will go and touch there, and then when you are touching that pet, you will get contact with the chemicals passively. Then without your awareness, you enter into the that allergy. So these are the preventive measures. So how we can diagnose this, how we can know means by history collection. So a medical physician, so a physician can do this history collection by asking certain systematic questions from where, uh, how many times. So, but there is some criteria will be there. Systematically, they will collect all those information. By that, they will get it. And physical examination. So here you are looking here one of the with using some magnifying glass. They are looking what is the type of that acne will be there. So what is that? Means by in the skin there is blisters will be there, how it will be. So with observation, they will look all those things. And patch testing. Here, one of the person, he is having so many patches on his back. So by this, these are the patches. They are keeping on the uh, certain place. So that usually back. So what they are doing means they are placing this patch up to 48 to 96 hours. Then after that, they will remove this. After removing that, there is a certain allergic formation will be present on their body. So normally this pack is containing some allergic reaction containing substances. So by this, they can understand that if the person is having allergic to certain substances. So this is about diagnosis. And coming to treatment. So what treatment should be recommended means here medical treatment. So medical treatment, there is a steroid creams and ointments will be there, and oral medications, antibiotics, corticosteroids, on antihistamines, and immunosuppressives. Means immunosuppressives not for all the persons according to the severity. There is the physician will get a recommend for the client. So these things required. This medical treatment is required for a individual. And what are the interventions? So here avoid the irritant or allergen. So whatever that irritant substance will be there, we probably avoid that dust, whatever it will be, and avoid scratching. We should not scratch that area. If we are feeling itching also, we should not try to avoid scratching. And apply cool wet compress for 15 to 30 minutes. We have to apply a cool compress on the skin and soak in comfortable cool bath. So there is oatmeal based some thing will be there, so that we can easily available in the market. By that we can soak in a comfortable cool bath will be applied on that particular area. And apply anti-itch cream or lotion to the affected area. So we can apply some lotion and protect your hands. So if you are having developed uh, uh, itching due to some allergens, probably you should use some gloves and all, and then only you could expose it on that substances. And what is the role of multidisciplinary team? So there is a systematic procedure is going on in hospitals. After getting means a person who is underwent these diseases, they don't have idea that is allergy to whom should I approach. There is certain doubts will be there, and there is delaying will be there. Somebody they are sitting at home as like that. So uh, you should not do like that. If it is if it will be disturbing from so many days, means several attempts happened, then immediately you have to go to the hospital, that is any community level. Community healthcare centers will be there, and in district level district hospitals will be there. So whatever areas you can go, and there is primary care physician will be there. If you approach him, he will give you a some remedies. If it is not subsided, then if it will be getting any uh, complicated, then I refer to uh, inpatient department. And if a child is underwent this infection, then a pediatrician can take care about it. Then in inpatient department, there is nurse will be giving providing some interventions to you, and dermatologist. So completely a skin will be taken care by dermatologist, and a psychologist and counselor. They will provide a mental well-being to a client. So there is a by after getting these overall your body, there is so appearance of that skin. Nobody is not touching. Means it is not contagious, but they may think that it is contagious. So at that time you may feel so much uncomfortable. So at that time, for reducing from all those thinking patterns, negative thinkings and all. To reduce all those things, like psychologist or counselor will help you to come out from that situation. And dietitian, he may recommend you to take a proper diet. What you have to consume to get a speedy recovery. And there is, so this is about, till now we saw about what is hypersensitivity, what are those classifications, and what is contact dermatitis, what are the causes, what are the symptoms, and what is the risk factors, complications, and prevention, diagnosis, and treatment, and interventions. So now we are going to understand that allergy proofing. So how we have to stay our home and community dust free, means allergy free. Not only dust, there is similar, some substances will be there. So how we have to protect ourselves, that I would like to share with you some remedies. So first one, there is keep humidity between 30% and 50%. Keep air conditioners clean. So nowadays, if this is summer, frequently there is a upper class people, usually they are using air conditioners, and not only so when whomever using, not only upper class, whomever using these air conditioners, so they have to keep it clean, and keep clean and tidy pillows and mattresses. So with warm water, you have to clean that pillows and mattresses at least 15 days, 7 to 15 days. Frequently you have to do, and wash bed linen every 7 to 10 days, and store nothing under the bed. So you should not store anything under the bed, and use washable window shades. So whatever you are using window shades, that should be washable. If you are not able to wash, at least you give that a dry cleaning, and you have to protect yourself to avoid all those things, and avoid heavy curtains, and remove unnecessary furnitures like rugs, stuffed or real animals, toys, books, upholstered furniture, plants, aquariums, and wall hangings. So near child bedroom, we should not keep all those unnecessary things. So we have to avoid all those things. So why? Because all the things, means dust particles will be settled everywhere. So to clean all those things very hard. So that's why you if it is possible, try to avoid all those things, and use wipeable furniture. So whatever furniture you are using, that should be easily wipeable, like that wood or plastic, vinyl or leather. These things you can prefer in your home, and avoid rattan or wicker furniture. So whichever will be, that furniture will be rattan and wicker, you can avoid those things, and cover walls with washable paints or wallpapers. So walls, whatever will be there, you should be uses wallpapers, and it should be easily washable, and limit child's exposure to animals. So especially in asthma patient, so the child is getting allergy very easily due to asthma. No, the child may be getting allergy due to certain things. So for that child, we should limit the exposure to animals, and change child's clothes after playing outdoors. So we should this is we commonly use it to do, that we have to practice it, and wash child's hair, uh, and we have to if the pollen is pollen count is high on his hair, then we can make him to do head bath, and don't get exposed a child when lawn is being moved. So if the child is having dust allergy, so when lawn is moved, we should not make him to expose into the that area. And we have to cut short our bushes, trees, and it should be frequently trimmed. When the where the pollen count is more at the trees, we have to do like this, and keep windows and doors closed during pollen seasons, and wet mop and bare floors weekly, and wet dust and clean child's room frequently, and wash showers and shower curtains with bleach or Lysol at least once a month, and avoid odors or sprays, and repair leaking or dripping facets, seal cracks and crevices in cabinets and pantry areas, and use pesticide sprays and boric acid powder to kill cockroaches. So whatever we are using at home, there is so many rodents will be there, cockroaches will be there. At the time, what we have to do, we have to use certain sprays, and we have to kill them, and we should be means that our area should be keep it clean, and cover all food, including pet food, and store garbage in closed containers, and keep shoes outside the home, and place doormats both outside and inside all the doors. We should place the mats, and don't allow pets into the bedroom, or especially in bedroom we should not allow the pets to come and settle, and bath pets regularly, and dusting regularly, and vacuum regularly. So in the floors should be dusting regularly, and you should do vacuum with the vacuum cleaner, you do cleaning. So these all are about uh, certain allergy proofing remedies. So I hope you understand better. Thank you very much for giving this opportunity. Thank you. Over to you, sir.
Thank you for covering the detailed aspects of allergy types, causes, preventions, and in detail about contact dermatitis and available medications in detail. Participants, if you have any queries, you can raise your hand, or you can put your query in chat box.
Hi, ma'am. This is the second time I got to hear you. That day, one time, and today. So both today's topic, you have done lot of research. From your PowerPoint, I can see you've done detail and not 100%, but 200% justice you have done to the topic. So it's a wonderful effort you have taken, and for the presentation, as if you have done for an exam, you have done 100% justice. So have no doubts, because you have clarified everything about allergies and everything. My heartily congratulations to you and appreciations. God bless you, ma'am. All the best, and all the best for your life also. Thank you.
Anyone else have any queries or comments? You can raise your hand. Okay. So if there are any queries, then we can take up at the end of the sessions. You can drop your queries. We'll move on to the next session. Thank you, Divya, once again joining for for the wonderful presentation. With every presentation, you are improving your communication skills, presentation skills are improving very well over presentation and presentation. So do practice and definitely hope you will be in a better position, presenting in a better way. Congratulations. Okay, then. Thank you. Stay as per your convenience. You can listen to other sessions as well. Okay, now, after listening to Divya, this is very important topic. Basically, the entire webinar is based on this allergy, because nowadays allergy is termed as silent killer. You know, a lot of people are falling or getting this allergy. There were discussed different types of allergy, food allergy and drug allergy, and there are different types of allergies that has caused, and it is unknown even with the children, when it pets and with plants and around certain, when we are, and it is based on individual. It's not like everyone is allergic to something. Like it depends from individual to individual. So we have to be careful, always keep our homes or surroundings clean, and see regular dusting happens from time to time, and discard anything whichever is unnecessary, whichever we don't want. I mean, unnecessary lying that will accumulate lot of dust, germs, and all other things. And maintenance also becomes difficult. So always it's necessary, not only physical but also mental, psychologically also. You have to remove unnecessary things from our brain also, in the thought process also. It will keep occupying our existing space and keep interfering. So that will affect our health and well-being, our development also. So, very informative session. Now we will move on to our next speaker. Let's see. Nagaraj ji, are you available?
Yes, sir. Yes, sir. I am here. I am there.
Okay. Thank you. Let me invite you, introduce you. Yeah. Today, after listening to Divya's very enlightening and insightful session, let's move on to our next session. Today, we have another speaker with us, Mr. Nagaraj ji, past president of Rotary Bangalore Abilities, member of various professional organizations, and he is presently deputy manager in State Bank of India, Bangalore. He is also a social worker. He does a lot of philanthropic activities. So we invite you, Nagaraj ji. Thank you for joining us, and we invite you once again to take over for your session on social work interventions in environment.
Yeah.
Over to you,
So
sir.
good afternoon, everybody. Good afternoon. Thank you, Ravindran sir, for this wonderful opportunity for me, and respected other speakers whom we have heard since morning. Dr. Satish sir, who spoke about yoga and health, which is very very important aspect, and Mr. Pritesh sir, Dr. Pritesh sir spoke about aging and health. In that, he has covered about disability issues also. Thank you very much, sir. And just now we heard from Dr. Divya madam about allergies. So very important aspect of the health actually. So as the days goes on, we move to the April month. And as I'm working in State Bank of India, I was having a hectic work in the month of March. So today I came to our village to get a very good environment, very good air, very good climate, which is a part of our life. So when we come across these things in our life, I thank Ravindran sir and Mary Florence madam for this wonderful opportunity again to bring me whatever possible I'll try to cover in this session. So first of all, as we are celebrating today the I think yesterday we celebrated World Autism Day. So it's a learning disability, and we need to treat and take care of these people and make them to lead a very happy and healthy life. And as a part of Azadi Ka Amrut Mahotsav, today is a very important day, April 3rd. One is that asthma prevention day. That is, we need to take care of our air. Our oxygen is very important. So always, when you sit in front of behind the trees, so you will not get any diseases, especially this COVID or this kind of diseases, because we will be very healthy. So it's a part of life. As Amrit Mahotsav Day, today is a special day. I said that Madam Kamala Bhai Chattopadhyay, her birthday today. So as is such a great occasion, she is actually contributed to
Nagaraj ji, you are muted. Nagaraj ji?
Can you hear me?
Yeah, now it's fine.
I think I'm sorry. I think it is muted. Somehow I didn't know. So I'm talking about this Amrut Mahotsav Day. Kamalabai Chattopadhyay's birthday today. She fought for the socio-economic empowerment of the women and for the freedom struggle. She was there with Sarojini Naidu, and she is one of the role model women. And as you all know, in the Amrut Mahotsav Day, one more occasion is that our person, I think a lot of Jhansi Rani Lakshmibai and I think Udbhav Patel. So all these people have struggled for this freedom struggle. On this day, some people are actually shot dead by the Britishers. So when I come across this environment is a free gift of nature. We are living in this environment, our surroundings. So social work intervention is very important in the environmental sector, because we are the persons who are contributing much for the growth of our environment. We say the sustainable development. One side people say we want more industries, we want economic development and all these things. And the other side, they cut a lot of trees. Destruction is happening a lot. At that time, we are there to protest. We have to work hard to improve our environmental condition in a very big way. So I wanted to look up this aspect in different ways. One is we do the casework, that is we adjust the people with the environment and we give the good life everybody to the environment. When you say air pollution, so because of this dust allergies, because of this lot of smoke in the factories, because of destruction of the this trees, environmental pollution, so this kind of air pollution happens. We need to improve air by planting more and more trees. For this, actually, we need to educate the people to plant trees, more and more trees, improve our ecology, and not only planting trees, we need to improve that. Like we need to take care of that. When after planting trees, after we have to come up by seeing by assessing after 1 year, these plants should grow. this plant should improve, and we should educate the people to grow more and more trees. That is one aspect in casework. And the second aspect in casework is from the childhood, for the family, for the women, for all the sector, environment is very, very important. Everyone should, look after our environment. Everyone should, we are living in environment. We are getting air, free air. So we are getting free water. In future, after 2030, people are telling we have to buy oxygen tanks. You all know that when we got COVID affected to many people, people bought oxygen tanks from different places. Because of this, our health has affected a lot. So to improve our health, we as a social workers should focus on our health. So now I want to tell you, 7th of April, we are celebrating World Health Day. So what is health? According to World Health Organization, health is a physical, social, psychological, social, spiritual, intellectual, and total well-being of the person, and not infirmity or disease. When you say physical health, we have to improve our body health. Body functioning should be proper. We should have a very good breathing. Breathing is very important, which all the speakers spoken about. And we should have a very good skins, very good heart beating, very good blood circulation in the body. All these things, for that, we need to have a very good nutrition, adequate food we should take. Especially when you say adequate nutrition, we need to take a good protein, carbohydrate, minerals content, fat content, all these things. A balanced diet is very, very important in the physical health. Not only that, we should drink a very good water in perfect times. We should have a very good sleeping habit. We should do all the yoga and other physical activities. And we should have the positive mind, positive mental attitude. So these things gives you the physical health. When you say mental health, our cognitive, our affective, our behavior, all these things should be positive. We should have a very good memory, very good concentration, happy state, happy mental positive attitude is very, very important. So we should change that persons. So, stress is a lot in cities. So that is why work stress, educational stress, exam stress, so many kind of stress is there. To overcome this stress, we need to have a very good breathing, very good meditation, very good, relationship with the people. All these things are very important. When you speak about social health, so we should have a very good relationship with the family, society, our environment, our community, and everybody. So this is a well-being in the society. And when you say spirituality, we should, always pray God, worship. We should believe in a God. So all these things are very important. So sound economy, that is, we should have a very good financial stability. So like this, we need to take care of our health. Along with the health, as a social workers, we need to improve the health, and we need to prevent the diseases. We need to, promote awareness. We need to eradicate the disease. We need to screen the children. We need to give adequate nutrition to the people, and we need to focus on a healthy, happy, and environmental life. So when you say environment, so you remember Chico movement in this country, and the Medha Patkar, who actually protested for the environment. And we have also got Salu Marada Timmakka in Karnataka. She planted so many trees, thousands of trees, and we are also followed her. Even we contribute some of our salary for the tree plantation. Like this, we all should do. Then only our environment is very, it will be sustaining. When you come across group work or group activities, we need to form the group of people, and we should plan some programs. We should find out their needs, and we should actually utilize the resource and do some good programs to them, and we should make them to achieve the objectives. Very, very important in the group work. In the community work, we all should do social work camps, community organization programs. We have to identify the needs of the community. We need to do at least one tree plantation event, definitely very, very important. And when you take care of this community, the community will take care of us. So that is very, very important. We all should aware. And in social action, we need to protest, and we should fight against injustice, against the tree plantation cutting, all these things. And we need to encourage them to grow more trees. The two, Nowadays, this rainwater harvesting is very important. So everywhere we will get uneven rains, uneven monsoon. Agriculture is a very important thing. So during the COVID times, lot of people grown, the green revolution happened. Agriculture is the backbone. We need to encourage our farmers to grow more trees, plants, food crops, cash crops, commercial crops. And as you say, agriculture is a backbone. Agriculture irrigation, agriculture marketing, agriculture green revolution, and agricultural laborer encouragement. And everything we need to focus. Environment is also part of agriculture, horticulture, and sericulture. So along with this, we need to take care of our animal husbandry also in the farming, because it is all part of the environment. So rats actually will eat the crops, or cows will eat the grass. So all this, human beings also eat the fruits, vegetables, and crops, everything. So why we have to eat? Because we need to get health. Where we get these fruits? From the environment. That is why I request all of you to take care of our earth, because we are celebrating even World Earth Day also. When I take about social research, research is very, very important to do studies about environmental life, environmental development, environmental standards of life, everything. When you take social welfare administration, we should all do the planning, organizing, staffing, directing, coordinating, reporting, and budgeting. So this way, we need to do a lot of social work activities, and not only social workers' responsibility it is everybody's responsibility to take care of environment. When you grow the plants, we don't grow alone as a social workers. We involve the farmers, we involve the rural community, because they should work, because they will take care of the plants. Why we grow the trees in the schools? Because children will take care of these plants. They will pour the water, they will put the manure, they will take care of the soil things and everything, teachers and children. So like that, whole community's responsibility is there for the environmental protection. So mediation and counseling and advocacy, as well as bringing the change in the environment. And we want water. You are already buying water from everywhere. Earlier we were getting free water everywhere. So nowadays we are buying water. So this kind of spending for air, spending for water should go, and we should get a clean, nice, excellent environment, and we should grow a very good social work attitude. Like, we should change the attitude in the people. So that is the responsibility of social workers. As a social workers, we should say that self-transformation begins with social transformation. If I change myself, then I can change the whole society. So helping people to help themselves, or changing the community, changing our society, changing the attitude and habits of the people. So removing the bad habits like smoking, drinking, and all this chewing tobacco and all. Instead of that, giving education, taking care of environment, growing more forest and tree plants, and giving jobs to people and helping the needy people whenever it is required is a very big intervention of the social workers. So finally, I want to tell you that, so this kind of awareness and the seminars, conference which we are doing, it will definitely bring the enlightenment in all of us. So Buddha said, so we want to be enlightened, and Vivekananda said, we need to give education, which is a manifestation of perception, which is already in him. And Abdul Kalam said, so we need to, as a small is a beautiful, big is a disastrous. Bigger things when you do industry growth or whatever, environment when you don't take care, as a CSR responsibility, everyone should take care of our air. So air will definitely take care of us. So whatever oxygen we are getting, we should thank this God for giving such a nice oxygen for all of us. So only it is in our hand to take care of our trees, plants, and grow more and more trees. So we have around 140 crore people. Each one of us grow one trees, at least we will definitely be very happy, healthy, and this is what we can keep for future. So what I have grown 2 years back, these mango trees, this has grown into fruits. Today I am eating these fruits. So I'm thankful to this. So this way, all these things we will get only when you struggle, when you work hard, definitely that success will be there. So with this, I thank Ravindran sir and all of you for giving me this wonderful opportunity to share whatever I know. Thank you, sir. Yes, sir. You can take it. Any questions? I am ready to answer.
Thank you, Nagaraj, for taking a lot of initiatives in promoting and also saving and protecting, saving and environment. It's, though it was extemporary session, it was really nice, insightful. We all need to take care of our environment because today we are struggling for clean air. Indoor, especially more than outdoor, indoor airs are polluted. Because a lot of indoor pollution is cause for various diseases and disorders we are seeing. So we have to not only keep outdoors somewhere the nature takes care of the cleaning mechanism, but indoors when they are not properly taken care, then definitely it leads to a lot of allergies and a lot of respiratory diseases. So both the environment outside as well as inside is very important. And everywhere we need to take initiative because global warming, all these things are happening and rising temperatures. We need to have more plants, more trees so that the temperature also comes down and the uh, water retention capacity of the soil increases and the groundwater level increases. All this will happen only with the plantation, sustainable plantation. It's not that you plant 1 crore trees today and tomorrow all are dried up and at the end of the day or at the end of the month we don't have any trees. All this plantation will go in waste unless and until it is very well properly taken care, as Nagaraj ji has already mentioned. Community engagement is very much required. Whenever any such plantation program, every government is taking up such plantation programs, but we need to ensure that the plant is being protected till it grows to a complete tree. And community or whatever, wherever the plantation is drive is being taken up, it's all responsibility of the locals. I mean, wherever the citizens residing in and around to take care of the plants and ensure that the growth of plants also is adequately managed to cover the necessary green coverage of the planet. Thank you, Nagaraj ji, for touching up on various aspects of environment and opponents who have and the various social workers, those who have contributed to the environment. Thank you for joining us.
Thank you, sir. Thank you.
Participants, if you have any queries or comments, you can put in chat box or you can raise your hand so that I can unmute. Yeah, Mary ji.
Hi, Nagaraj.
Hi, madam. Thank you for the opportunity.
Thank you very much for the very informative and very useful information. What I didn't know about environment, you have said, and from village you are shooted. So it is heartful gratitude from my side for coming and doing talk for the session. And a lot of takeaway and a lot of points which I have jotted down about the environment. Since I know you're doing a lot of work in environment, but today I heard it heartfully. Thank you once again for coming and presenting, and God bless you and all the best for your life. Thank you.
Thank you. And anyone else who has any queries, you can raise your hand or you can put it in chat box. So, okay, thank you, Nagaraj ji. Everyone is appreciating your wonderful session. So, look forward for your presentations and participate in future events. Thank you for joining us.
Thank you, sir.
So now we will do our next speaker. We have with us our next speaker, Sri Arun Mohanji, wellness coach, Rotary Bangalore Abilities, and he is also governing council member of Multiple Sclerosis Society of India. So he will be talking on MS and life wellness. Yeah, Arunji, you can unmute yourself.
Good afternoon, everybody. I'll just start with sharing this presentation.
Yeah, good afternoon, Arunji. You have one more challenge today to connect to the environment and air pollution.
Today, just a minute. Okay. Good afternoon, everybody. My name is Arun, like I was introduced, and I am part of the Rotary Bangalore Abilities, taking care of public image for them. And I am also the governing council of MSSI. No, MSSI is nothing but Multiple Sclerosis Society of India. As difficult as it is to pronounce multiple sclerosis, for convenience sake, I would be calling it, I call it MS, than saying multiple sclerosis. It is going to be much more easier for everybody to understand what MS is all about. And yes, like what Ravinder sir said, it is going to be difficult for me to, you know, uh, link between the environment and multiple sclerosis. But what happens is environment plays a huge role for us also, because today we are we are going through a disorder which where heat plays a huge role for us, and the weather makes a lot of difference to all the multiple sclerosis person or person with multiple sclerosis. And it makes the environment that we are sitting around plays a huge role for all of us. But before I try to tell you, how the environment plays a huge role, I want to probably tell you what multiple sclerosis is all about. Now, I probably will go through, run through a short presentation where I talk about MS and give you a brief insight of what MS is and what people go through. Now, MS or multiple sclerosis is a autoimmune neurological disorder that people go through, especially youngsters. It's not especially; it is diagnosed when you are at your prime age of a human being, which is between 20 and 40, and that's where people are diagnosed, and what they go through is a complete set of disability which people are find it very difficult to understand also. it is basically a neurological disorder where our own immune system is eating the outer covering of the central nervous system. So that means the signal that goes to the brain and the return of the signal goes haywire. Now, what happens is our central nervous system, or the nerve of a human being, is covered with a outer covering called the myelin sheath, and our immune system thinks that this myelin sheath is an object from outside and attacks and tries to save the body. Now, when the myelin sheath is scarred, or when the information that is passed through the nerve system goes haywire, the reaction is completely different where the brain is concerned or the spinal cord is concerned. I'm not just saying brain, spinal cord, it is also the optic nerves which make a lot of difference. Today, our human brain is covered with around about 4 billion nerves which are interconnected, and the information that goes from each part of the body goes through the brain. And when the myelin sheath is attacked or eaten by the immune system, the messages are not going in the right manner. It is simple as saying, if you take the charging cable of your mobile, and if you cut the charging cable, you have probably 4 or 5 copper wires inside. Now, the rubber coating which is there is the one that insulates the copper wires from sending the wrong signal. And when this rubber coating is broken, sometimes the mobile gets charged, sometimes it doesn't get charged. That's the same thing that happens with the nerve system of our entire body. Now, this is just to make you understand what MS is all about. Now, if you look at the prevalence of MS and in India, they say is that 2.8 million people are affected with MS across the globe. Now, out of the regions, if you look at the regions which are mainly affected, it is the Americas and the Australian and the northern European areas where it is affected. Now, if you look at these areas, basically these are the colder regions. Now, in India, we have close to out of a population of 1.4 billion people, they say there are around about 2 lakh people who are affected with MS. Out of this 2 lakh people also, MSSI is the only patient caregiving non-profit organization which is there in India, and we have around about 3,000 odd people who are registered with us, who are willing to come out and say that they are MS. Now, if you look at the regions where people are affected because of multiple sclerosis, it is the eye, it is the brain, it is the tongue. When I say tongue, it could be the speech. In fact, I was having a slurred speech for around about 2.5 years when I was diagnosed, and that's probably one of the reasons why I got diagnosed that I have MS. And then you have, I will probably tell you about that more a little bit further. It could be the digestive system, it could be the urinary it could be the urinary portion of your body, and it could definitely affect your balance or uh, your legs, your hands, and your spinal cord, which are affected. So what happens is, okay, let me put it this way. When I was diagnosed around about 6 years back, I had gone to a government office at 7 in the morning, and the watchman there didn't allow me to get inside the office because he said, in fact, I had gone to the passport office, and my mother was there with me, and I had an appointment at 7 in the morning for renewing my passport, and the watchman there said, "You're not allowed inside because you're drunk." So my mother, in fact, protested and told the watchman, "How can you call my son drunk? That too, when you're saying this in public, and this is at 7 in the morning." He said, "No, it is because he is drunk. He is not able to speak properly. He is not even able to walk properly. He is not able to balance himself because of how drunk he was." So that's when we decided that we need to go to a neurologist to figure out what is wrong. And within probably a week or two, I was admitted in the hospital to actually go through, because what happens is MS is, to diagnose MS, it needs you to do and go through an MRI where you see, which are the parts of the body, which parts of the brain or the spine which has got affected. And that's when we realized that, there were these scars which are there on the spinal cord, and there were scars which are there on the brain. Now you do not know which part of the part of the body is affected because of the scars. So like what you are currently seeing, if you take the neuron, it is covered with the the myelin sheet, which is covering the nerves. And when the immune system attacks your own myelin sheet, it's the nerve fiber gets, probably, to put it in a blunt statement, it's probably naked, and it gives the wrong signals to the neuron, which says, for example, if I want to walk to the right, the signal that goes to my brain, my eyes, my hands, everything goes towards the right side. But the signal that goes to my brain says go to the left. So I walk to the right and to the left. So people, when you have this kind of, where you're having a wavery kind of walk, people definitely think you are having either an issue or issue nobody understands, but they first thing that notices is that you're drunk. This also includes tremors in the hands, where probably to be literally honest, I have not held a pen or I have not written anything for the last 5 years because I cannot hold a pen and write properly. So that's how bad it is. And today, because of my balance issues, I use a walking aid so that people understand that, there is something wrong with this person, and they help you out, or they tend to, be aware of, there is a person with a problem who is walking in front of you, and they tend to help you out. Now, if you look at, like I said, what MS is not, what people don't understand what MS is not. MS is not contagious. It's never directly inherited from your parents or your family members, or it could be a gene disorder which affects. And the biggest issue is that it is always severely disabling. Today it could be the eye. Tomorrow morning it could be something else, which is the problem. Say for example, tonight when I sleep, I'm perfectly all right. I'm able to walk properly. I'm able to see properly. Tomorrow morning when I get up, I do not know what my state of affair is. I could go blind. I could go paralyzed. I could go hard of hearing. I could go, I could, anything could happen. Now, the disability is so bad that there are occasions when it is severely hot outside, the temperature is around about 30, 32, 35 degrees outside. I will be sitting and shivering inside because I'm feeling cold. And I would, there are days when my mom is, everybody is feeling so hot, and I would ask my mom to give me a sweater because I'm feeling cold. And there are days when there are sometimes, especially in a place like Bangalore, when the temperature goes down to probably 15, 20 degrees, and everybody is feeling cold, and everybody is, wearing a sweater or a jacket, and I start feeling so hot that I'm actually sweating. I'm actually sweating so badly. Now, what the what people go through are, it is the most how do I say it? It's one of the most non-symptomatic disorder that people go through, or there are no visible symptoms that I can say. You might look at me walk and say there is nothing. Today I look perfectly all right, and when I say I'm perfectly all right, I feel perfectly all right. But it is how you go through it. What what MS is not a reason to stop working, to doing things that one enjoys, and it's not a reason to have children also. In fact, I have a son who is gone to his 12th standard now. So that's how probably the MS is all about. I'll probably show you, like this slide says, what are the possible symptoms. I told you, I covered most of the symptoms that people go through. And it could also cover diagnosis, dizziness that I'm talking about. The biggest problem of MS is, one of the biggest problems of MS is fatigue. I'm the only person who could, I am, like I said, not the only person. I am probably the kind of person who would get tired after taking a shower. It is that bad. Now, I could, people say, when people look at the kind of issues that people have, people say, you know what, I also get tired after taking a shower. It's not like, you need to rest after taking a shower. You could have had 9 hours of sleep, and you could still wake up saying that you're so tired that you cannot move your hand and you cannot move your legs. So it is that bad that that MS symptoms can get into. Probably one of the reasons why I'm telling you all this is, though in spite of all this, if you look at the previous slide, I said you do what you enjoy the most. And believe me, one of the best ways to overcome multiple sclerosis is staying positive and being positive. And I probably will make you I'll show you a video that MSSI had created for me. Probably you'll understand what are the kind of pains that I go through. I'm just playing this video. It's a 20-second video. Okay, I probably need to tell you how my life changed after this video. When this photo shoot happened, it was saying, why don't you do a photo shoot for MSSI? And we showed the invisible symptoms of MS. Now, when this photo shoot was done, and when these photos came out, the kind of things that I got to do, I would have never done if I was a normal person. I became, I'm not boasting about it, I became a model where I got opportunities to do a lot of photo shoots after that, saying, by looking at only the bad side of MS, you look at the positive side of MS, and that's when I got to do, like I said, a couple of photo shoots, and I got to walk the ramp in a fashion show. Not just one, I think around about 3 or 4 of them that I walked the ramp. And these are things that I would have never imagined to do if I was a normal person. So MS brought out the best in me. And today I do voluntary work for MSSI and for Rotary Bangalore Abilities. In fact, Rotary Bangalore Abilities is the only club in the world which works with the disabled to showcase that disabled people can do stuff also. So now, sorry. Okay. Now, what are the 4? There are 4 different types of MS which people could go through. One is the relapsing remitting MS, or the RRMS, which is the most common form of MS that people go through, and that's probably the beginning of MS, and that's when people are diagnosed, and the symptoms are not constant. It happens, and then the relapse happens, and then it goes steady for some time, and then the relapse could happen again, and you become steady after some time. The next, after that is what you talk about, the secondary progressive, where the symptoms worsen and the relapses and remissions or the constant way when you start feeling all right is not constant. The third is the primary progressive, which is not a very common type of MS that you find in across people, especially in India, that you talk about. And the fourth one is where you talk about progressive relapsing, where your disability becomes the worst kind of thing, where you know the disability becomes permanent. Now, if you look at MS as a disorder, you know, three to four women get affected. You know, out of say 5 people, a group of 5 people, if you take, there are 3 to 4 women who are affected by MS. So the percentage of women is much higher. Now, 15% of the public in who have MS have, you know, maybe one or more family members or relatives who might have MS. When you talk about the identical twins, 1 out of 3 chances are there, you know, one of them could have MS. Now, what are the people? What can people do to feel the best? If you look at, you know, you need to balance activity with rest, and you need to, you need to talk to a rehabilitation professional, and you know the right amount of exercise is what can help you. You need to eat a balanced or balanced diet kind of thing. You need to avoid heat as much as possible, because you tend to become heat sensitive. You need to drink plenty of fluids to maintain bladder health and avoid constipation. You need to follow the standard preventive health measures for the age group that you're going through. You need to manage medical and psychiatric comorbidities, which could help, which could speed up the process of MS progression. You need to understand the most common emotional reaction. See, what happens is, like I said, this disease affects the younger age group, and when the younger age group is at its prime of your health, you've just turned adult, and you are ready to work, and you are ready to look at what this world is all about, and expand your horizons, what you say, and you need to, you are all set to bloom. Is when this disease is identified and diagnosed, and all of a sudden you are called a disabled, which is not easy situation to be in, or easy emotional being to be in, where you are all set, where you think your life is all set, and you are ready to explore the world, and you're ready to create or do wonders across in your life, and you suddenly become disabled. And that's one of the most, I would say, the most emotional reactions that you can go through, where you are so depressed that you are set and your fall begins, when you're set to create, you know, do wonders across in your life. Now, what also what else people can do to feel better is, one is accepting the fact that uh, there is a disorder called multiple sclerosis and you're going through it, and telling people or making people understand that you have an issue, and people we think your human beings are not willing to understand. They are willing to understand only if you tell them that you have an issue, but most of the people hide themselves from, or are do not disclose that they have an issue like MS. No, you have uh, you need to decide who your physician is and stick to those physicians so that they understand your history and they understand uh, everything. Your employment choices. Employment is one area where which makes a lot of difference to a lot of people, because today organizations are not willing to accept or are not give you reasonable accommodation, where they're not willing to say, okay, I don't mind employing a person with multiple sclerosis, because they cannot, or one, they do not understand. Two, they are not willing to accept the fact, how can somebody the biggest example that people talk is, how can a person be so tired most of the time, and because your employment is an issue, your financial planning, uh, uh, you know uh, financial issues are a big burden on you, where one of the biggest problems that I most of the people go through is the cost of medication, because like what I said earlier, today in India especially, the you know there is no insurance company in India which covers multiple sclerosis. So it becomes a big issue where the insurance is not covering your health. And I'll give you an example. The kind of medicines that I used to take, 4 injections in a month would cost me $40,000. So that's how expensive that we are talking about. So when you have worked, and when your life is about to start, and when you started working and you've saved some amount, and the entire finance goes for a toss because of the medications that people go through. Health and wellness is something which is very, very important for uh, for most of the people, where if you don't take care of your uh, well-being or your wellness, and that's where people go have an issue. The reason why I'm telling you all this is uh, one point that I must tell you this is that this disease is more prevalent in colder regions than the hotter regions. So what happens is, uh, the more hotter it gets, especially in India, the more problems you'll find people coming out with MS, lot more obvious. You will not believe, in MSSI we have found that we have had people as young as 10 years old who have been diagnosed with MS, and you have people who are who have uh, just about reached the middle age to a little senior age level when they were diagnosed with MS. So I think that is all I need to tell you about MS, and I hope I gave a little bit of insight of what MS is all about, and how we require all your help, and you know in creating this awareness and letting people know what people with MS go through also. So I thank you very much, and thank you so much all for listening. Thank you. I'm open to question and answers, so you can. I'm willing to answer any question. Thank you so much.
Thank you, Doctor. Thank you, Arunji.
My pleasure.
For a wonderful presentation. And it gave insights into MS and what challenges MS gives to its impact population. That is a very, I mean, the percentage is also increasing. So we need to really address this issue so that we can see that proper intervention is provided. Thank you once again for joining us, and we can see both the speakers, Nagaraj ji and Arun ji, is very well done. Coming from abilities, having very well presented. So that gives us a lot of motivation that we can do much better, always much better, and we can always try to support in the way we can, which is not being done as expected, maybe to that level which is required. So we all need to really address these issues. Thank you, Arunji, for joining us, and as usual, you rocked the session. And participants, if you have any queries, you can unmute and ask. Otherwise, we can move on to the next speaker, and we can take any sessions at the end of the all sessions. So you can leave in chat box also. Okay, there is only appreciation, no queries or clarifications. Thank you, Arunji. So we will move on to our next speaker. We have with us, just I will take a moment to introduce. Yeah, we have two people raise their hand. Mary ma'am, you can go ahead.
Hi, Arun.
Hello.
Hi, Arun. Each time you tell about multi-cirrhosis, more and more knowledge we are getting, because we are just learning from the multi-cirrhosis, and you have done great justice to the topic. And each time I hear the presentation is more effective, me in what way I can help for this multi-cirrhosis society. So that's how I can spread the word, because each time I've heard you 3 times, but each time it gives a different opinion about what it goes into me. I do a lot of learning. So all the best, and thanks for the invitation of coming.
Thank you. Thank you.
And all the best, Arun, for your life and for the next session.
Thank you. Thank you so much.
Thank you, Mary ma'am. We have another participant raise their hand, Jekar Raju. Yeah, go ahead.
Sir, good evening, sir. Myself, Jayakar.
Ah,
I am actually KTP patient, kidney transplant patient, CKD patient. I got invitation from Jayuta Foundation, sir. Sir, I have one query, mood change and anxiety related things. Will it comes under multiple sclerosis, sir?
Oh yes, oh yes. People, uh, uh, you will not believe the anxiety and the depression level that people go through is tremendous, tremendous. Because I personally, being a life coach, I understand what people go through when you talk about anxiety. Because you know the level of when people, you do not know what will happen you know tomorrow. So yes.
Means, I feel frequently like whenever I go to meetings, top level meetings, top management meetings, so I feel somewhat nervous or anxietyness, and some points may miss in the meeting, in sudden speeches. So I could not sort out this problem. Since
See,
maybe
yes, I understand what you're talking about, but when like what you said, when you're going for a meeting and you tend to forget people, the moment you start telling people that you have an issue,
yes,
and the people get to know about it, the moment you tell them, people are also understanding. Out of a group of say 10 people, 9 of them are understanding, one person might not understand, and that one person is what is creating the issue for you.
yes.
So you need to think about all the nine people who are there with you.
Yes, sir. Yeah.
Because what happens is, when we start, we always think about what is that we don't have.
Yes.
And we forget that we are lucky enough that we have, what all we have itself in our hand. So that's probably one of the reasons why I keep telling everybody, past is history. Tomorrow is a mystery.
Yes.
Today is the present.
Yes, sir. Yes.
And that present is the gift of life.
Yes.
You need to be happy about that you're living and breathing right now. And we not to worry about things that we don't have and what could go wrong. And if it happens, it happens. So what?
Okay. And sir, can we expect more percentage or more number of cases in case of these patients who are using immunosuppressives and steroids continuously? Like I'm using immunosuppressants and steroids since 20 years nearly. Okay, at the age of 20 years of age, I got a kidney transplantation.
Okay.
And since that time, since 20 years, I was using these medicines. So because of these medicines, is it inevitable that we will get these kind of symptoms or these kind of multiple sclerosis like things?
See, what happens is, today the problem with MS is, MS, nobody knows, when a person could get affected. Okay, it is not, the immunosuppressant is the only thing which will actually help you survive.
Okay.
Today, the kind of the injections that I talked about, they are all immunosuppressants that you have. And so when you start taking this medicine, they are the only things which can help you, because your immune system is going to get affected, and immune system is not eating your own nervous system, outer covering. So these are the only, in fact, you will not believe if I say this, for the last 2 years, 1.5 years, I'm not stepped out of my house.
Oh, okay, sir.
So, people say COVID is a big thing. I'm not stepped out of my house. So it's that bad. So, you need to protect yourself and you need to be careful about yourself too.
Okay. Yes, sir. Yeah.
I hope I was.
Yes. Thank you, sir. Thank you so much, sir.
Thank you. Thank you, Jacob. I think Dr. Top has asked me a question. Hello? See,
Yeah, thank you, Arun.
yes, I think Dr. Top has.
Yeah, Gayatri has raised her hand, so let's attend to her.
Thank you, sir. That's really wonderful session and amazing to see you guys presenting in such a way and very informative. I just had a doubt, like, is this diagnosable?
Is this?
Can we diagnose this? Are there anything for the diagnosis? Generally, other disabilities, coming to other disabilities, there are certain symptoms like what fall under this. Then we try to diagnose. So
Yes.
is there anything for MS?
See, for MS, the only diagnosis that happens is through an MRI. That's the other pain area. MRIs are not cheap also today.
Oh, yeah.
So the MRIs is one way, and the other way that the doctor diagnoses to confirm that you have MS is something called as lumbar puncture. Lumbar puncture is where they take the spinal, the fluid from your spinal cord, and they do the testing for that.
Okay.
To confirm whether you have MS. See, the problem with MS is that MS mimics a lot of other symptoms. So now, me being a typical example, I'll tell you, I was, for 6 months, I was treated with Parkinson's disease because of my tremors, and my tremors was extensive. My hands, like I said, it's been close to 6 years since I've written something.
Okay.
Because shivering was that bad. So
yeah, I got.
So when people before you take an MRI, before I took my MRI, I was said that maybe it was the earliest symptom of Parkinson's. So that's what I got treated for. And then 6 months later, I was said, no, it's not Parkinson's. There is something else.
Okay.
The kind of problems that I'll tell you, I'll give you another example. Sorry if I'm taking too much of time, but then, I'll give you another example. I have something called nystagmus. Nystagmus is where your eyeballs are going right and left. Maybe not in a heavy manner, but slight, but it's going right and left. So for me, everything was shaking, going right and left. And because of my tremors, my head is going up and down. So for me, everything was going in circles. So what people don't understand is because, people tend to look at you and say, why is this person staring at you? I'm still trying to figure out where you're looking at, whether you're looking at me or looking at something else. So these are the common symptoms that, people go through.
Generally, coming to vision part, you said that your eyeballs rotate. People tend to say like, okay, maybe a squint or something else where the vision should be corrected, right?
Yes. See, I'm not talking about my eyeball going. Okay. I don't know if you can see me. For me, everything is going right and left right now.
Okay. Okay, sir.
And I look normal to you. My only the cornea part is shaking for me.
Okay.
So for
And
me,
can I know the age groups, like what are all the age groups vulnerable to this? Like, any age group, like, toddler or school going?
no, it's not the school going. It's mainly diagnosed if you take a population of say 100 people. I take a group of 100 people. Maybe 80 of them are between the age group of 20 and 40.
Okay, adolescence. So you
Yes.
mean to say it's an
I wouldn't
adolescence,
say
right?
adolescence. It's the young adult where you
Yeah.
cross
Okay.
the 20
Adult.
age mark and just before 40.
Okay, sir.
So
Thank
it's
you.
between
Thank you, sir.
20 and 40 that you are normally diagnosed.
Thank you, sir.
Thank you, Gayatri. Is there any other question that I can help with?
Yeah, thank you, Arunji, and also for participants for asking queries and clarifications.
Hello.
Hello. Who is this?
Hello.
Bhagwanji, do you have any query? Do you have any query or clarification on the Arunji's session?
Hello, sir. My voice is audible, sir?
Yes.
Hello.
Hello.
Okay, I think there are no further queries or questions. So let's move on to next session. Thank you, Arunji, for once again for joining us and for clarifying. Kindly stay back as per your convenience. If any queries, we will take up at the end of the session.
Sure.
So, moving on to our next session, we have Bhagwan Reddy D. He is founder and president for Chayuta Foundation for Organ Transplants. He will be delivering his session on awareness on organ donation. It is first of its kind in India that is formed by kidney transplant recipients to serve kidney patients. So this is one of its unique kind of NGO, and we are listening to the founder president, Bhagwan Reddy ji. Over to you for this session. Bhagwan ji, can you switch on your audio?
Yes, sir.
And
Hello?
video?
Sir, may I audible, sir?
Yes.
Yeah, good afternoon, sir. First of all, thanks for giving the opportunity to talk with you all. Myself, Bhagwan Reddy. Proudly, I say I am a kidney transplant recipient. After my kidney transplant recipient, so I have initiated to do something related to organ donation. So first of all, I want to say about myself, about my kidney failure and my kidney transplantation. So why kidney transplantation is required for me, and in the future also why organ donation was required in the country and for everywhere. So I want to say a few words about the organ donation. So actually myself, Bhagwan Reddy, so I got kidney failure in 2003. So when I'm studying my graduation, my sister has affected with the kidney failure, and after a few months, she has expired due to the same disease. So my disease has came through genetically. So unfortunately, mine is polycystic kidney disease. So when my sister has expired, my doctors have suggested to go for a checkup of so small tests like creatinine, ultrasound, and HB. So like these tests. So doctor has suggested me to go for every 6 months for these tests regular basis. And when I'm studying my MCA, that's in 2006. So I got small fever. Then I went to hospital. I was checked that my creatinine level is 1.27. So after I decided for a suicide. So because of my sister has expired due to shortage of organ. The same I feel like that. So, but I have read some books and some articles in the net. So then I came forward to register as so to get the organ NOTO, so National Organ and Tissue and Tissue Matching Purpose. Now the India has started organ donation campaigns now. So, but in 2003, 2006, that time this is not there. So because of that reason only my sister has expired. So organ shortage is very high in the list now also. So but awareness is not there on organ donation. So frankly, I am telling you. So when I diagnosed with kidney disease, so I have taken the hygienic food and water, everything I have taken. But even though I got kidney infection, so after that, my mother sister came forward to save me, and she has donated kidney to me. Saying that is in 2012, almost 10 years back, she has donated, and she is fine. And I'm also fine. So after that, in 2012, I got kidney transplantation. So after that, I have discussed with some doctors and also few kidney transplant recipients. So how we are going to move forward on creating an organ donation and save lives for kidney patients majorly and also other patients. So because of that reason, I have initiated a WhatsApp group with 4 members. So though all are kidney transplant recipients, so that's in 2015. So now we grown to 997 kidney transplantation members in my group across Telangana and Andhra Pradesh states. And I'm the founder for the foundation, and I am the state coordinator for All India Kidney Foundation also. So after creating my foundation, so we are going to villages and schools and dialysis centers majorly. So we are motivating the dialysis patients and their family members to save the patient of their family member. So as everybody knows, so organ donation and kidney donation is only family members can donate the live kidney organ donation. Otherwise, one more is that that is a deceased organ donation. That is a cadaver organ. So we have two options: one kidney failure or any organ failure. So either family members can donate, and other one. So cadaver organ registration. This is the cadaver organ registration. So came in Telangana and Andhra Pradesh states. The Jeevan Dan Foundation that is implementing by Government of Telangana and Government of Andhra Pradesh. Here organ donation, why organ donation is required. So I want to say, so organ donation, as I say, my mother sister has saved me. So to donating the kidneys, but so my sister cannot save due to organ shortage. At that time, that awareness is not there. So because of that reason, I came forward to so do something on organ donation. Here I am saying organ donation is two types. One is a family member can donate, and another one is brain death. Brain death person can donate. So that is a deceased organ donation. So I want to say organ donation from a brain death person gives new life to many patients. One patient brain death person so can save 8 patients' lives. So let us get together and make everybody know the immense importance of organ donation. So life is very precious. Let us make good use of our life even after our death by organ donation. So it is sad, but true that every human being is a mortal And we should remember the age old saying, from dust through art and to dust through shall return. So if our organs are not utilized at the time of death by donation to others, they shall go for a waste. As you know, so after many of the the patients, brain death patients, the family members cannot give the signing on the donating the body. Consent from organ donation is never by compulsion and it's completely voluntary. So during life, every human being, while in normal health, can pledge to donate his or her organ at the time of death. These individuals are given donor cards. I will show the how to take the donor card from the website. So I will show here now. So consent for organ donation is lakhs of people are suffering with end stage organ disease in India, and overall holding their brain eagerly waiting for somebody to donate the required organ to them. Unfortunately, not many are coming forward to donate organs. Organ donation, so done at the right time, so will appropriately benefit the needy persons. In Telangana state, they come up with the cadaver transplantation program, special program that's called Jeevandan. So it's a common platform for organ donation and organ allocation and transplantation across the Telangana state and Andhra Pradesh states. So Jeevandan has also taken up the responsibility of educating the public about the need of organ donation, especially this is a cadaver organ donation. So this organ organization was started by the state government of that's in 2012. So before that, in Telangana state and Andhra Pradesh state, so Mohan Foundation is there. So when I diagnosed with kidney failure, that's in 2007. So I registered for cadaver organ in Mohan Foundation. So at that time, my organ serial number would be the 700 plus. So 700 plus means it takes almost 7 to 8 years. So then, so dialysis is very critical. So when the patient dies, don't know. Here, more than 30 hospitals registered themselves in Jeevandan scheme, and thousands of patients from different states have been registered and prospective recipients. Jeevandan organization sincerely wishes that these are organ individuals' life, a good life in the days to come, and wishes that our dreams are made to come true by each and every person by donating organs after their death. So the government of government of Telangana or government of Andhra Pradesh, all other government, state governments are doing cadaver donation, cadaver organ register. But our foundation, Chevita Foundation, is going to the rural areas and urban areas, especially dialysis, where dialysis are happening. We are going there, and we are facilitating organ donors. Already donated persons are there. We are facilitating them in front of dialysis patients and their family members, because so they are very important. The dialysis patients are suffering with kidney failure, and their family members are seeing and the problems of the patient. So even though we are facilitating in front of them, and they family members come forward to donate the kidney and save the family member's life. So that's the thing we are doing ground level in Telangana, Andhra Pradesh states. And even we are helping the dialysis patients with the supporting of distributing medicines, fistula belts, and motivating the family members to move this hospital and that hospital. So there, the hospital cost is very less. Even though we are giving 1 lakh rupees, if anybody is willing to go for a kidney transplantation, if the family member donated. So like the different way we are doing. So our foundation is India's first organization formed by kidney transplant recipients to serve kidney patients especially. So this is a major about kidney for our foundation and organ donation majorly. So here I want to share something how to register for organ donation. You can see here. Here is the website jeevandan.gov.in. So see, be an organ donor, all it costs so is a little low. So one person is equals save 8 lives. 2 kidneys, heart, liver, pancreas, lungs, eyes, the different organs you can so donate also even after death also. Here you can see how to register. Just you can click anywhere on this website. Just you can click here. So then donor registration process is there. Individual and the through organization. Here individual, you can go with individual and fill all the details, the name, surname, father name, date of birth, the occupation. So here it is asking, do you have any hypertension, do you have any diabetic, blood group, so any other. So here you can fill all the details and you can select liver, kidney, heart, pancreas, lungs. These 5 organs are the major are requirements so across world. So you can submit the button, then the donor card come to your mail ID automatically. So you can register as organ donor, and these donor card you can put every time in your packet. So then that will help us. So when anybody got accident or something, so they have hospitalized for a brain death, the doctors can declare brain death. These cards very useful. So if this person is willing to donate the organs, and also the family members can also know so about he is willing to donate organs, then you can after death also you can save also minimum of 5 to 6 candidates, and lakhs of people are dying shortage of organs. So organ donation is very much required so in the world. So we have to create awareness on this. So even after my kidney failure only, I know say about how much importance of this organ donation. So I want to say if anybody is willing to organize organ donation camp across India, so we come there and we create the awareness, even though we will support your location dialysis patients or kidney transplant recipients with medicines and other. So this is a very good opportunity for giving me to say something about organ donation here, and this organ donation is very much important. Ravinder sir, so thank you sir for giving the opportunity. See, if anything missed, our teammate Mr. Jayakar also there, he can say something. So if I missed any, so if you have any questions, please ask me.
Thank you, Bhagwan Reddy.
Thank you, sir.
Yeah, thank you for your wonderful insights. Yes, definitely. There is need of our and there is a lot of myths also associated with the organ donation.
Yes, yes, sir.
One thing is the cultural aspects where the last rituals are concerned. You know, because culture has also, I mean, in both ways it is there, but we need to take in an appropriate way. We cannot go against culture in any this thing, but we need to create a sensitization that even, of course, there are different ways of performing last rituals also. We need to have a proper understanding of how the last rituals goes on. And there are provisions also for donation in that. So how the body can be best used. And even after we have to create awareness that even after organ donation also, all the rituals can be performed without any objections or without any hindrance. So that is also, that has to be ensured, because sometimes we might feel a difficult thing or a stigma or a taboo talking about these things, but these are very important. When you say you donate your body, then what will happen to my last rituals? The next question comes. Then why, how I will reach my abode? Because without performing last rituals, I mean, in a particular culture, then you will not reach the heaven or hell, whatever it is, based on your karma. Then that is also a very important aspect we need to include as part of awareness. So you need to take certain quotes from various scriptures from all religions, not specific to one religion.
Yes, sir.
You need to take, because this is very sensitive issue, right?
Yes, sir.
So,
Very sensitive issue, sir. Even we are going to dialysis locations, sir. The patients are suffering with the dialysis. Even the family members don't know about organ donations. How they have to save the person who is suffering from the family member only. So, but most of the families are not willing to donate. As we are facilitating in front of them for the donors, so they are coming forward to donate the and save the family member. So even doctors are motivating them, even though they are not come forward to donation of live organs.
yeah, there is one concern, because being a social worker, being a health professional, being a counselor, I am also, we do also promote, and we are also working, like whoever comes forward, we are also trying whenever there is an opportunity, please do donate. But the kind of, motivation that goes them, people in the very first place, we have to ensure that there is maybe some kind of assurance or reassurance that we should form a donor community in the very first place. So whoever is willing to donate, let them form a community, have regular interaction between the community members, and let them be the warriors, the volunteers for the cause. So they, if suppose you have enrolled for the donor form and you became the donor, today you possess a donor card. Let's have some groups or online interaction, offline interaction, where we together go there, go and create awareness. Like you did wonderful job, you being kidney donor recipient, you try to reach out to other recipients, and you are doing wonderful job, that you are creating an reassurance that we all are fine in spite of taking kidney or donating kidney. We still survive, we are able to do wonderful job, and we saved one life. So similar kind of assurance also should go. There are a lot of initiatives taken by the government, very well appreciated, as you also said about them. But at the ground level, as you have also seen, these things, sensitive issues needs to be addressed, and we need to have a active donor community where the willing people who, it's not just once you take the form of donor and you leave the donor as it is. You don't even contact unless and he is in the last breath. So that should not happen, because you should motivate the donor, and in case if donor's family require any organ donation, then what? So that a kind of community has to be created. So in that case, if they also feel that no, if even I donate, I come forward to donate, and in case if any of my family member requires such a donation, maybe a similar way, if sometimes if they can also come to rescue, then more people will come forward, because everyone want to secure their families, everyone want to protect their families and put them in a scaffolding. So maybe that is one initiative that you can take it up, so that it will create a close bonding among the donors and recipients. And also whenever there is a requirement, continuous awareness programs with the help of donors or donor recipients can also bring a very good, rapport, and also very good impact, I would say, on the society, or even donors can motivate, like, yes, we are a strong community. We thrive for this objective, and we also support in case any of the donors' family who have registered as a donor, and if they require, let them give a little more priority, because when they are donating, they have come forward for the noble cause. So maybe they also, to promote based on the emergency, some such initiatives need to be worked out, and definitely we wish you all the success, and more such initiatives can be taken. So if Jaker wants to share something as a donor recipient,
yes,
they are welcome. Yeah, Jayakar, you can go ahead if you want to share something.
Yes, sir. Thank you, Ravindra, sir. And your inputs and insights are very great, sir. Now, whatever you said suggestions, actually we missed out those things like cultural things and cultural stigma. All these things we missed out actually because that plays an important role in general community who is not having means in-depth medical knowledge or something like that level. So that plays an important role, sir. Actually, whatever you suggested now, we will definitely try to incorporate. We will definitely incorporate in our next agenda, sir. Definitely. And whatever Sir Bhagavan said, regarding organ failure and organ donations, as the trend is increasing, the failure trend or organ failure trend is increasing in India because of so many reasons uh, like contaminated food you say or like work life stress we will say, okay, or lifestyle we will say. So all these things are contributing to for organ failures. So whatever the pace or whatever the means speed it is growing, organ failure is growing. Maybe government is not coping up to such extent to address all these issues. So Cheyuta like foundation, Cheyuta Foundation for Organ Transplant, like NGOs are actually contributing or helping to patient community as well as for economical growth overall. And in this actually we patients require more inputs from CFOT and like you NGOs and awareness programs whatever we are discussing till now. We need to increase actually till now we are conducting only in Telugu states. We need to increase nationwide, sir, because cases are increasing and we are expecting more cases in more cases means more increasing trends in coming future. So your insights ideas are very much important, sir, to us like patients. And apart from awareness programs, we are anyhow helping financially and supporting in different forms. Like we are donating medicines. Uh, we are helping financially, and we formed our own schemes, own policies like Chayuta Nivas, which is actually helping patient attenders to attend their diagnostics or whatever the treatments at major cities. We formed a what is that uh, uh, we formed a group and we are planning for Chayuta Nivas means that program. That program actually helps attenders who is coming to major cities and could not stay at hygienic places. So we are creating a hygienic place for them, and they can stay and they can treat, they can go. So like those special steps also we are taking, sir. Means in depth we are going into this organ failure cases, and we are trying to touch every corner, sir. And regarding youth, unemployed youth for an sustainable economic growth, we are actually asking the government help for reservations or jobs for these kind of patients. So thank you, sir. Thank you, Ravindra, sir, for giving such an opportunity, great opportunity. We expect more like these things in future also.
Yeah, definitely. We are always there. In fact, Bhagwan receives lot of updates from me, but he is so busy that he is not able to make it.
Sorry, sir.
Yes, sir. Yes,
Actually,
yes.
you know, I am working
Recently,
in MNC company, even social service sector only. So even though I am servicing this patients community, so that because of that reason, I am very much busy, sir. As you know, sorry for not responding sometimes.
Means we have a more strategic plan, sir, to address all these issues in a strategic way. Uh, to balance, we will say big words like to balance all economics.
Yeah, definitely. What you can do is like, see, one Sunday, every Sunday we are having webinar like this. One
Okay.
Sunday we will, what we will do is, we will take up only on entire organ donation. We will
Yes,
have
sir, nationwide.
on organ donation.
Okay.
And we will discuss like you, Bhagwan, and who are active members, no? Or
Yes, sir.
you can invite one from anyone from government also, from Jeevan Dan,
Okay.
one official. And we can, if possible, you try to invite other organ donation organizations or who are sponsors or who are supporting you. You know, we can have a national webinar like this on one Sunday, where it is entirely dedicated to people who are working, and we will try to create awareness. So we can discuss all the topics, no? From actually how this failure is happening, what are the various causes. Generally, see, nowadays what happens, we are not taking adequate water. That is the main reason for kidney failure.
Yes,
But
Yes,
what
sir.
is
Work stress, mainly work stress also.
Yeah, the first thing is not taking
Water.
adequate water.
Yes, sir.
True, sir.
That is causing, because we are not trying to eliminate the waste from our body, and that increases the temperature in the body again. So dehydration, this hydration problem is there. Again, blood circulation also gets affected. Like these simple remedies there. Drink adequate water. Keep always water bottle with you, in front of you, in front of your eyes, so that you should see always a water bottle. You should always drink. You make a habit to take a sip every 15 minutes, or you put an alarm, take a sip every 15 minutes or 30 minutes or 45 minutes or 1 hour. Like this, might be you have found lot of tips and tricks. So make a book, a small book, pocket book for children, for adults, so that they can use. And also we can use social media banners or flyers, where we can actively use on social media. By next webinar or whenever, whichever day we plan, let's come up with something, give out like this, some ideas where we can reach out to greater public. Once we start making in a way, once we can, if we can make a start, then definitely I think many people will join us, and we can take it forward to schools, colleges. And see, nowadays there is a greater opportunity, because lots of colleges, as per NAC requirements, they have to conduct various community engagement programs and various sessions. So you can reach out to college. Every college has to conduct certain programs.
Okay.
So organizations like you have a greater opportunity now. Earlier there was a little bit less. Only thing is like you also should approach, because I know being in campus and being an academician, being a student also at the same time, I know both. I keep studying, I keep teaching always. So I know both sides of the academician and the student, this thing. We always,
sir,
as a
even-
student,
even
I
we-
always look to engage in the program. As an academician, I also look forward for organizations who come forward and do some activities. So similar way, you also need to approach colleges, schools also for that matter. Create,
Yes, sir.
design content accordingly. So children will not understand all these things. So we have to prepare content accordingly. And for college going children also, we need to come up with a different content. I mean, content would be same, but the presentation should be different. And similarly for working professionals, maybe for IT industry, a different kind of presentation, understanding their challenges. And for other industries where there is a hazardous industries, or where there is a greater risk of getting kidney failure, there we can have different content. So these can be prepared. We can have we can give one day, whole day platform to you, so that if you can come up with content and speakers, so we can, I will also try from my side. If you can suggest that if we invite this person, it would be great. Then we will also invite them and extend our support. We can have one day and see how this goes on. And we will also extend you where you can also create awareness and like that. And also do participate in conferences, online, offline, wherever you get an opportunity to, because thousands of people will be attending and coming forward. Academicians will be coming, students will be coming. They will take, once if they like their our presentation, they will take forward. Immediately, we can't expect that whoever is attending will go and create wonders tomorrow. But slowly, we have sowed the seed today, and it will take time to become a sapling. It will take time to become a plant. It will definitely grow to a huge tree. But that depends on individual and opportunities available to that individual. So definitely, your efforts also will definitely one day become a huge tree. And hope we will see that more donors are available and donors are actively willing. Like blood donation, people come forward. But again, we know now, and blood donation is very easy, because he can donate the blood and he will get replenished in no time. But the organ donation is not like that. No? Only after the person's death only we can take after brain dead. Otherwise, living person is that also we need to create awareness. See, when there are two kidneys and one is both are effectively functioning, when the own family member is there, so we should also reassure or assure them, the donor, that there is no disadvantages of. I mean, definitely there is a compromise, but definitely you will be saving one life, and there is not that risk if you take adequate care. So that we need to ensure. Most of the time what happens is, okay, if I do, I'll give up one kidney. And if something happens to me, I have only one kidney. If something happens to that one kidney, again, who will give me? So that is also, because these are practical concerns. When earlier I was doing counseling, people used to ask me these questions. So I also used to say, okay, I mean, it's when it is your own family, definitely they will come to rescue, as you have also come to rescue. Whenever they require, you are helping them. So definitely that same member cannot donate back, because he is also having only one kidney and you are also having one kidney. If anything such happens, there is another family member. So that kind of assurance is also required, and we need to protect such things, and we also need to prepare the other family members also. Like this is where this donors, when we try to group the donors and give assurance, a kind of assurance, like if you have been donor, in case tomorrow if you require anything, we are there, our community is there, we can give you priority donation, because you have already donated, you have saved one life, and it is our responsibility to see that if something happens to if something unwanted, untoward happens to you, we are there to rescue. That kind of assurances are required, what I think from my experience. Hope you also had similar experiences also. So
yes, sir. Because of uncertainty only, people are actually stepping backward for these donations. But as you suggested, we address family-related things, emotional things, and cultural things. I think most of the percentage of crowd can accept this organ donation form.
Yeah, we need to address these issues. So, but let's see. We'll plan one Sunday, this coming Sunday or next Sunday.
Yes.
Whenever your team is ready, you discuss within your team and get back to me. We will
sir. Sure,
organize
sir.
and see, we will take the feedback and see how it goes, and we can take it to colleges, schools as well.
Sure, sir.
Thank you, and both of you did a very wonderful job, and it is the need of the hour, because environment impact is also more on health. So a lot of this metal pollution, high metals in the water, and also air pollution, and also the food pollution, because of
Yes, sir.
lot of chemicals, fertilizers we are consuming. Because of that, also organ failure is happening indirectly. So
True,
these all environmental impact is there on these issues. So definitely it is the need of the hour. Thank you for joining, and it was really wonderful listening to you. And hope definitely you will get the support you require, and we are there always whenever you reach us. Whatever kind of support we can do, we will definitely do it. Thank you.
Thank you, sir. Thank you.
Participants, if any of your any of the departments have any queries, you can raise your hand or you can unmute yourself. Otherwise, we'll unmute from ours. Yeah, Mary ma'am.
Hi, sir. Hi, good afternoon, sir.
Good afternoon.
Actually, no, sir, your topic was very near to my heart because my own best friend is a heart transplant patient. And she's the first woman transplant in Karnataka.
Okay.
And she was a hockey player, and she's gone heart transplant for two times. One in 2009 and one in 2017. And after that, she participated in the World Transplant Para-Olympic, and now she's Limca record breaker.
Great.
And plus, after that, that illness did not stop her, and she started a foundation called Lighter Life Reena Raju Foundation. So, and what's the motto of the foundation is choose to live. She chose to live, and she's with this illness, she wants to give it. And right now she's in USA. Otherwise, if she was in India, I would have connected with her. She's in Texas because she's a difference of timing. So what and all you went through, I have seen it with my friend.
So kindly share her contact number to me. So we will.
Actually, no, sir. First, when she was diagnosed dilated cardiomyopathy, she was living with only 500 ml all through the day. Wow. Only so much water. And being a hockey player, she's used to doing all exercises, and she's not supposed to, 3 years she was inside dose. Okay. And continuous checkup and all. And 2009, when we approached Dr. Cherian Foundation, Chennai, they told heart transplant. We don't know what is heart transplant. We don't know knowledge. Then we referred so many people. They told us, I'm from Bangalore. So we registered in NIMANS, and they put us to Narayan Hridayalaya, which is in Bangalore. And they put us to Dr. K.M. Cherian, which is top cardiologist in India. He's got the Padma Shri Award. So he operated her in 2009. Again, 2017, that heart didn't work. Again, second transplant. And in spite of that, she's a runner, marathon, and she gives talks, more motivational talks. And I'm so proud of her. Like, in spite of her illness, she didn't give up. So we are childhood friends. Actually, many people, after she got transplant, many people left her because she didn't have money or didn't. But the only confidence I had, I've seen her as a hockey player in state level. I thought this girl will come one day flying. And to the year back, 2020, when this pandemic happened, they chose her for the Limca Book of Records. So when I'll take your number from Ravindra sir, as soon as she's back in USA, May 15, she's back, I'll give her number, sir. And now what she's doing, and now what at present in a foundation, what she's doing now, she is a heart transplant patient. She raises funds for future heart transplant patients.
Oh, great.
Because this since Bangalore is the IT company, and she's full of this one software engineers. People get a lot of money, so she's helping few future heart transplant, and plus she's taking so much medication. She sponsors medication, financial help, anything. I will give her number as once she is back to from USA. So,
Thank you, ma'am.
so why I have personally taken you as because I see my friend in you, sir. So I know how the trouble she went through. I know what you're going through. So I'm sailing in the boat of you. So actually, I was there for a surgery when that heart came in a big box, and when 8 hours surgery, I was there for the second transplant only. I know what pain you're going through. So as a sister, as a friend, I know. So I always pray for you, sir. I believe in a God, Lord. I pray for you, and because of God, only you and my friend are living today.
Thank you very much.
So God bless you, sir. So you're personally connected with me, so I'll always keep your things. That's why I raise my hand to tell my personal experience.
Thank you very much.
I pray for your good life and good health and long years to live. And usually when she's back, I'll give her number to you, sir. And
Thank
I'll
you.
take your number from
Thank
her.
you, ma'am. Please, please.
If I speak to her on weekdays, if she's ready to support you, I will immediately, within May 15th, I will contact you. All the best, sir.
Thank you. Thank you.
Thank you, Mary ma'am, for sharing this story. This is what happens, when we are fine now, we don't care about our health. When something happens, like we are collapsed. So this is what this is what the negligence we do. In fact, whoever is, we don't drink proper water, we don't take food in time, we don't take proper rest in time. Because this we spoil our own health, and later when there are some health issues, we struggle a lot. So definitely I think maybe these stories will definitely, not story in the sense, but these definitely these things will definitely create a lot of impact. So there is a greater need that we collect experiences from them, like Bhagwan also shared today, and Jayakar also shared. Now we all need to create some sensible time videos, and we have to share with the normal population, because when they are safe and they are careful, there is no need of organ donation in the very first place itself, right? There shouldn't be. When we are talking about people who need organ donation, but we have to prevent the organ donation in the very first place itself. When we take care of ourselves, then there shouldn't be any demand for organ donation tomorrow. If that is taken care, lot of the demand is addressed now itself. So we need to show them that if you don't take care, then you will become like me, and you have to struggle like me. It's not in a negative aspect. See how much pain and all thing. Because I am fortunate today, I got some transplant. Today I got some donor. What if the unfortunates who couldn't get the donor, what will happen? That kind of fear has to be created so that they will also take care of their health, and they will also come forward for donation. So certain emotions, feelings are required. We have to address them. Otherwise, people are like, "चलो जब होगा तब देखेंगे." तब देखने के लिए कुछ भी नहीं है, भुगतना ही पड़ेगा. So that kind of attitude is widely prevalent with all of us.
Sir, after COVID, many cases are increasing, sir. Organ failure and kidney failure. So every day I'm getting so many calls. So when I'm talking with the patients, so they are infected with COVID. So after that, many cases are increasing. So within span of 1-2 years, most of the cases involved with the kidney failure only.
This lifestyle also,
yes,
especially has increased lot of things, because we are just simply sitting in the closed spaces, not much activity, and very limited. Most of the junk food or very selected food, not Sometimes not junk food, but very selectively. We take only selective food where we are not getting all the proper nutrients. That nutrition deficiency is also affecting again. So these things, it's not just simply we have to address one thing, but we have a greater challenge of, first of all, saying why an organ fails. So we have to maybe take up awareness in such a way that what makes an organ fail, and so what makes an organ keep running healthy. So maybe we have to start conversation, something like that. I mean, you all are the better persons to frame such a catchy line or something like that, because you all are
Sure,
working
sir.
in
We will
that
come
field
with
exclusively.
we will come with you, sir. So when Sunday, as you suggested, we'll plan, sir.
Yeah, ma'am. We will definitely reach out to universities, colleges also. Once we execute it and we see how it works, then we will also take it to colleges also.
Thank you, sir. Thank you, sir.
Okay, ma'am. Thank you. And yeah, Jaykar, you have something to say?
Hello.
Yeah, Jaykar.
Yeah, sir. Sir, actually, your motivational words and Mary ma'am motivational words are actually motivating me to speak again and again. That's why I raised my hand again, actually. So, sir, actually, whatever we are speaking now, it is we digested that there will be organ failure and we should act upon it. And as a part of proactive mode, the government actually, we should tell the government or we should request the government to take some proactive measures like quality control over food, quality control over some work culture. So the two three points, if they focus and if they formulate such policies, maybe to some extent that will help. That is a future aspect of Chivita Foundation. This we thought in our long term goal, which is means we are having as a Chivita Foundation, we are having short term and long term goals. So this goal, these kind of long term goals, we kept after 10 years actually. So for these kind of goals, your valuable inputs are required in future.
Definitely, we are there. I mean, whatever we can contribute, definitely we will give you. I mean, we are also very limited in experience in that particular field, but whatever we feel or whatever we experience, we are definitely willing to share.
And whatever Mary ma'am said now, that is so much motivating that one of her friend has got 2 times transplantation and she is a most successful person.
Yeah, we need to. That's why, as I said, now we need to create such at least a few motivational talks where we can share, and it has to be widely circulated in social media, so that health is important. Once I mean health gets spoiled, or when such a condition exists, it's very difficult. That's what we need to convey. That will create a lot of awareness among the citizens, and at least we can avoid certain things which can be prevented. This is 100% prevented.
Yes.
Maybe in 1 or 2% cases it is unavoidable, but which can be really prevented. And we can also increase the favorable attitude or perspective towards organ donation.
Yes, sir.
So definitely we will see. We will see how to take it forward.
Yes, sir. We will collaborate, sir.
Yeah. And all the participants also do spread the message about foundation and their activities. So we can take it up.
Thank you very much, sir, for giving the opportunity. So thank you very much, sir.
Thank you, Bhagwan, and thank you, Jaykar.
Yes, sir. Thank you.
So it's already 3:30. Okay. So we'll take up, we have Vasanta ma'am with us. She's retired from Women and Child Department, Karnataka. Vasanta ma'am. Vasanta ma'am. Ma'am, can you hear me? Hello, ma'am. Okay then. So we have seen since morning how this environment, air pollution is effectively, affecting the health, not only health in terms of human health, animal health, and also planet health. So that's a triad which we are addressing as One Health. This One Health concept yeah, thank you, George. So this One Health concept is the theme of this year's World Health Day, and World Earth Day is also our planet, our health. Because as long as our planet is not healthy, we are also not healthy. When we inhale polluted air, when we drink polluted water, when we eat the yields from polluted soil, we also get polluted. And how we get polluted? We get polluted with various diseases and disorders. So it's our responsibility, prime responsibility, to ensure that we all are keeping our planet healthy. So how do we keep planet healthy? By having sustainable practices, by not abusing the resources, being conscious of how resources are being used, by not wasting the resources, and by using clean and renewable resources, clean, green and renewable resources. So today, this day was dedicated to air air pollution and different diseases that is primarily caused due to air pollution. Now we have seen the asthma, bronchitis, allergy. These are widely prevalent and are silent killers. You know, these are very breathtaking diseases. They will make you lifelong suffer. You know, once you get any of these, then it is very difficult. You have to manage, that's all. It is very difficult to, though there is a medication, but it will make you, that medication itself is so addictive that it will make you addicted to that medicine. Without that medicine, you can't survive unless and until you change your lifestyle. So you need to make a lot of changes, and that only then you can get rid of it. So it is very important in the very prevention stage itself to keep our air clean, use sustainable, instead of fossil fuels, we have to use clean and green energy, where we can use alternative fuels like hydrogen fuel, or use electricity or use sunlight, solar energy, or similar technologies where we emit zero pollution and we create e-waste, zero e-waste. So that should be even with
I am here.
Hello.
Hello, Ravindra sir, I am here.
Yeah, ma'am. Welcome, ma'am.
Yeah.
So as we have come to the ending of the session and already we met the time, you can briefly go ahead and conclude in 10 or 15 minutes, ma'am.
Yeah.
Okay, ma'am. Over to you, ma'am. We have Vasanta Talya Ramarao, ma'am. She was working with Women and Child Department. She is retired officer. Over to you, ma'am.
Thank you, sir. Thank
Thank you.
Good afternoon, good evening, all the gentlemen over here. It's my privilege to have this session with all of you. As the admin had asked me to speak about the child health today, it's my pleasure to speak about the child health with you all as per my experience. I'm not a doctor, I'm not a scientist, but I have worked with the children for more than 45 years in my life. So, according to my experience, I'll speak. The first thing is that the child health means child life starts with the mother's womb. So, in the mother womb only, there will be so many protections will be given to the mother to the child, not to get the diseases. So, when soon after the child birth, if the delivery delays, the soon after entering the labor ward within 5 minutes, the baby delivers means it's a normal child. If the mother takes long time or for the delivery, the first problem is that asphyxia. The disease is it's not actually a disease, it's an problem. It is called asphyxia. Asphyxia means respiratory problem will start for the child. So suddenly child may die also. In India, when I was in the field, the percentage was more than 12%. Due to, we call it as infant death rate, IMR we call it, is that asphyxia was the main cause. Because in the rural areas, the deliveries will take place with the ayahs, the untrained daddies and untrained women, the seniors of the village like that. Even the auxiliary nurse midwives have been appointed for each 5 villages. Sometimes they'll not even call up them and they will take the help of the senior citizens over there in their village. In such cases, it happens that asphyxia will take place. Due to the delayed labor, the child will expire. So that is called infant mortality rate. That is the major history of India today. They are doing lot of researches, lot of studies, lot of work on that. So in the meanwhile, the with all the protection, with all the care and blessing, the child will be protected. And soon after the delivery, we have to protect the child against tuberculosis. Tuberculosis is very easily affected the children of that age. So tuberculosis, against the tuberculosis, BCG vaccine will be given soon after the birth of the baby within a month also. Then the second and very, very important is polio vaccination. Polio is the major problem, is the disease for the children in all the countries, not only India, in many places. Nowadays, giving so much of pride, so much of vaccination programs, everything is keep on going on. In addition to that, it has been affected to the children. So polio and diphtheria is another major disease where we should protect our children. So with all these things, the children are like blotting paper. See, if you put something on the blotting paper, it will naturally absorb. Like the child is also susceptible to get anything soon. So we should take care of the children very much, very sensibly. We should take care of these young neonatal children. So neonatal children in all this protection, they will have any time the fever. Fever is the main cause and the digestive problem. So many health issues are there for the children. Maybe sometimes it is unhygienic conditions. Unknowingly, they will create these problems to the children. Sometimes these untrained mothers, untrained dais, and working women don't take care. They take care all the responsibility of the child, of their health, but the ayahs where they only they take care with them and they go off for their duty. In such cases also, these are the problems they are facing very much. So when they take care of ayahs or the caretaker attenders, they should train them very well regarding the hygiene and the problems which the parent will face if they will not take care of the child properly at that stage at their home. So this is a working woman's problem. Even if the mother is the not working woman, she stays at home also. Maybe due to so many high unhygienic conditions of the family, especially in the villages, vomiting is too much, and dehydration will happen because of the vomiting and loose motion. So, though government is giving ORS, which is free of cost, that is available everywhere in the village, even in the Anganwadis, even in the schools, they are keeping ORS and they are giving every training to the mothers when they are pregnant, how to take care of the postnatal care of themselves and as well as the child, neonatal child and the newborn child. Afterwards also how to take care of it. But they are not ready to accept these things. Still they go with their own thing. Due to dehydration also, that is also main one of the cause for the children's death. That the child will lose its whole energy from the body. So the parents will not take them in a right time to the doctors. They will not treat the children properly. So that will affect the child's health. So dehydration is a major cause in India nowadays, especially as summer is entering. As everyone is telling this year, the temperature will go very high. So it's very important to each one of us, whether the social worker, a doctor, or a caretaker of the or who has got a good heart, they should see the children that they will be protected against this high temperature of this year especially. So this is below 1 year child, and they will get measles, mumps. These are the major issues in the childhood days. So government is giving all the treatment, especially in the village level. It is free of cost. They are going to each doorstep and they are giving all the immunization schedule in right time, and they are maintaining a immunization card for each child and the mother also. In addition to that, uh, maybe still 1%, 2% mothers are not accepting all these immunization to their children. In addition to that, all the social workers, the field level workers, the grassroots workers, they're all giving education to the parents as well as the mother. Then also some problem is still going on. Otherwise, infant mortality rate IMR will not go high. So there is a big discussion about infant mortality rate in many forums of India. In all the monthly meetings, IMR is the major discussion point. It keep on going always in the government level also. So while thinking of the diseases of the children, childhood, what are the other things? The disease means not only the body functioning diseases, the health will be divided into so many aspects: mental health, moral health, physical health, social health. Everything is very important. The children at this age only, they look their parents as their model. Parents are their models. They are their friends. They are their teachers. They are their philosophers. If the parents themselves they are not good enough, they themselves will not have good habits. The father is a drunkard. The mother will have illegal activities. In such cases, child will certainly have the other problems like psychosocial problems. So obviously they will become the weapons for this society. So in such cases, the children will have many problems and the children will face many sequences. In such cases, we have to think of many things, many duties we have to conduct, and we should take care of the children very well in that area. Then coming to the next point, that children, 1 minute, sorry, I have disturbed. Children are very much essential for this society. So we need to have those things on them. Sorry for disturbance. In such cases, the parents should be educated first, not to give pain to the children. They themselves to the model to the children. But where these ladies are the uh, uh, illegal activities, they are involved. And some of the families, they have their own bad habits. And the father will be activated in so many robberies, so many things. And several times he went to jail and has come back. Though the child is the right person, but he will have, as he will take the father as the model of his life, so he will also naturally become a child, problematic child to the society. So the parents should be very careful, irrespective of educated or uneducated family. Nowadays, always the parents keep their mobile, the laptop in front of them, and they will be 100% engaged in that. So now, what is the problem with modern family? The problem is the mobile. No child will eat without a mobile. So parents, obviously, they are giving their children the mobile to eat, to feed, to have bath, or anything. It is like a tip for the child. Really, here we are doing this thing. See, today what we are facing, all the speakers, they are talking with many, many, many things. All are related to these children because what they are learning at the age of 3 years, that will go up to the 100 years of them. So the children are very much dependent on their mobiles nowadays. So it is like socio psycho problem for the children. So then, not if at that age, I had hundreds of friends in my village. I used to run away without telling my mother. Wherever I go, I used to play in the pond. I used to wet myself. I used to come home, though my mom beat me also, I don't care. Because I had such a huge friendship. We used to go and we used to play. Nowadays, children has no life at all. So these are all the problems. These are all the illness on them. So we should take care. Maybe as a grandmother, as a mother, as a friend, as a neighbor, if there is nothing wrong to tell them to take care of their children properly in this particular age. Then coming to the physical illness, in each year, not only 0 to 6 years, 6 to 12 years also, it is a difficult year, difficult age for the children. They will have sudden typhoid, pneumonia, these are the attacks of this. So every child should be protected against these things, giving proper immunization in a proper time, in a proper place also. It's very important. For this cold chain system is very much important. So I have to take care of all these children in this. And physical things, there's some of the children they have born with physical problem only. So they will have so many challenges, both parents as well as children. So physically challenged children, they cannot live as the normal child lives. So they will have some genes in themselves. So we should not use that to them. Nowadays there are schools have come up for each category of children separately. You should teach, you should educate the society in such cases to tell them the requirement and what are the facilities are available, and they have to make use of those facilities, and the child should be protected in such illness. So the child will be protected and child will be placed with all these things. So certainly child can assume himself as a good citizen of India. Then coming to the mental retardation, it is no way no one can help. No, we can help them. Only for the mental retardation should give them proper teaching from the childhood itself. Teach, please try to teach them the toilet norms and how to eat, what to eat, what to eat means hot, cold, that small things we have to teach them. So the people what they do, if a immortal is born, they throw them on a corner of the house. If they give them food, they leave them. Then in the evening they come, scolding them, they clean the toilet and that. No, not the way. Though this is a disease, though this is a problem for the child, the caretaker, the parents, the in-laws, the grandparents, everyone should take care of that child. So this is also one of the that childhood disorder which has started with the child. It will go till the end of the death of the human being. So with the little concept on them, little concentration with them, giving small suggestions to them, giving little love and affection to them, we can really change their habits, their life, their lifestyle. Coming to that point, there are schools for MR children. There are so many schools for kids. No MR child feels that I am MR or I am physically challenged. So they will be given there some job, something. They will earn 10 rupees. They come home so happily. In the age of 12 years, a boy came to me and he said, Mom, my salary has come. See, this is my salary. Do you earn? He was asking me. I was wondered. So nice. This 12-year child has earned 12 rupees. So nice, no? To her also it is good. Then I said, what job you are doing? He said, I am doing weaving. How do you do weave? When you come to my office, I will show you how weaving is going. Then he asked me, what you are doing? No, I don't know weaving. Will you teach me? He said, yes, I'll be your teacher. He's so proud to say that. So this is the way where we have to take their capacity to a level. To recognize each small capacity, each person, in each child, in each corner of their life. Give them more importance for that. Never compare children with the other good children. So it will be depress them. So depression is another major problem of the child. Don't put your child to depression. You mean parents, grandparents who are in and around the child. They are all the post holding around the child. They are all the models for the child. Never compare a good child with the other child. So don't say. In addition to that, we can do that. You are so nice. You have done this painting. What is this? So nice. What color is this? Put many questions to them. They will try to answer you. This is the way we can bring them out. This problem can be solved. Their health can be improved. This is very important from the age of 6 also. 6 to 12 years is the one age group where they learn many things. So 6 to 12 years, they will learn many things and they will follow their siblings, they will follow their friends, they will follow their teachers. Whatever the teacher does, same thing they will repeat at the home. So we are all the model for the children. So first we should be a right person for all these illness. So if without washing, I started eating in my home or in my school. The children say, my teacher never wash her hand. She will eat. Why not I should? So the model means in each step we should be the model person. Drinking water, biting the cup is not good. We should drink in front of the tea. Everyone lifting the glass and then they will also learn it. Yeah, my teacher never she sips the water from the glass. Always she takes the every minute they will watch them. Anybody for that. My granny is so nice. My granny, I love her so much. Why? They love them. It is auspicious. They love. So they should be the model for coming to the illness of the child in the adolescent. Nowadays, adolescence is a big problem. The adolescents, especially there, is that with drugs. sex, puberty, so many problems will come. When the father will drink at the home every day, saying party, party, the child very observed. He will be planning his own plans. When he will enter to the school, your mommy says you should not eat Pepsi, you should not drink Pepsi, you should not do this thing. They certainly agree with mother because they are very much afraid of mother. They keep quiet. When they come to school, when the parents give pocket money, they will go and first purchase Pepsi because it is age of experiment. They want to know, curious. They want to see what happens. So they knowingly, unknowingly, they will be addicted to many things. Once the child will be addicted in a teenager, it's very difficult for the parents as well as the counselor, as well as the doctor to bring him back is difficult. Then for all those things, again putting them on medicine is not good. Forcing them is not good. Instead of in the early stages only, we have to take care at the home, at the school, at the society for the children to not to learn these things. Nowadays, uh, when I was doing some counseling, one person came from Chikmagalur saying that my son is a scholar in the school, but in ninth standard onwards, he's not at all studying. He's always sleeping or laughing, sitting alone like that, and he will not even open up. Then they brought him to me. After doing all the counseling, after doing this family counseling, he came to know father was the cause to be died. So father, what he was following, just he is following the thing. Father was a bank manager. What's the use? But his habits are not good. So he is the father is the model for the child. So whatever father will do, the same thing child will do. Then after several sittings with me, child has secured a good percentage in his 10th standard exam, has come out with that problem. The father also agrees, yes, these are the habits which I am doing is not correct. So he also has come back. Now the family is happy. But the thing is that everyone should take responsibility. The child ill health will lead to the adult ill health. We know that 3 years growth will take up to 100 years. So whatever the child learns, it is in his age of childhood, it will go up to the end of his life. Then coming to the very, very, very burning problem of today is that diabetes. Diabetes starts in neonatal care. The mother, when she became pregnant, she starts with high diabetes and she will be put on insulin. So after that, after delivery, the mother will have no insulin, no thing, she will be normal. Doctor says it is some genetic problem. Okay, now she's fine. Okay, no need to worry, but be careful. Okay, the child suddenly at the age of 6 years, 5 years, started drinking too much of water, eating too much, always saying hungry, hungry, hungry. So when you take it to the doctor, they say he started with that. Once I was doing a slum survey. So they in a slum say the population may be 10,000. I got 4 children with that. Then sitting with many friends like you, I spoke to them. Let us start on project. But these diabetic children, let us give insulin. So we have done a lot of work on that groundwork, and also we got so many donors have come up. And even today, even with the COVID, we are not stopped it. We are giving free insulin to those slum children. So this is the one project where we have more than 1,200 children with diabetes. So it is in different area, not in the same 10,000 population, but is in different area. So this is another biggest problem nowadays we are facing in society. So a diabetic child, their parents should be given proper education. Their diet is also very important and tolerance should not be given to them. Timely diet is very important. High protein diet should be given. These are the things to be followed. The second category, when we do survey, I got it that the child says that he is not at all feeling hungry. The mother was very much worried, and all his test has been carried out. Pancreas is working properly. His insulin, this thing, insulin is proper level. It is protected. It is producing, but is not filling. Then we took a big history of the child and we took all the higher level doctors and all. Then somebody said in Hyderabad there's a doctor, he's specific for children in diabetes. With all the fundraising, we have sent the child to the hospital itself. After going there, they said the pancreatic wall, it is like shrunken. So the pancreas will secrete from the pancreas insulin, which will not flow to the body. That is his problem. Just to get it down, it was such a difficult thing. Then afterwards, after the doctor doing all these things, every 6 months one ton should be given to this child. That goes to 1 lakh. Again, donors are donating. Now the child is in 10th standard and he is a single parent child. Father is no more, mother is alone, and all the donors we are helping, and the child is getting. So nowadays, diabetes is another major issue, major disease in the children. And the next issue is that epilepsy. Epilepsy starts in the childhood. There is no cause for that. Maybe doctors can explain you more than me, but this is my experience where I have seen what are the diseases because I have worked in urban area, rural area since 45 years of my life. So I have seen all these by my visual. So epilepsy is called fit. So that they simply the child gets fit. They will bring some iron rods that he will do him, and they say no, it will go 5 minutes, he'll be all right. Luckily, 5 minutes child will get up. They will not even think that it's a disease for the child. So we have to educate it again them, and we have to get them treatment. The ratio, the several times where the child gets epilepsy after getting treatment, 10 times to 9 times, 9 times to 8 times, daily 1 time, then weekly 1 time, monthly 1 time, sometimes 6 months once, like that, it will be reducing and slowly child can grow himself and he can stand on his own leg. By the age he reaches 16 age, he will enter into adolescence, he will be very much improved with itself. This is a very important major treatment which we have to get it, and especially in the street children. As I have worked for the HIV project for a long time, many children they get this HIV. How do they get? The children, problematic children who have seen many problems with their parents, they will come out and they will have so many behavior problems. In one of that, the behavior is that cutting their hands, cutting their, making themselves wounded, the bleeding comes. They'll cheat others, they'll threaten the others. This is one of the habits they have. So they will not even use the things whichever is available there, a broken glass, a broken this thing, iron rod, pin, whatever it is there, simply they make wound on their hand. So by that also they will get it. Sometimes they will make use of used and thrown needles, syringes and all. And they make it as a weapon for them. They say, see, I am HIV positive. I will bite you. You will also get HIV. You give me 10 rupees. I have seen several children. Nowadays, HIV project has gone up very much. They are working very well. All the children are treated. Still, street children, it's very problematic. Is problematic issue with them, and it is very, very, very difficult to control them also. Until 18 years, we treat them as children. After 18 years, they are the adults. No one can take care of them. They have all the liberty in India, maybe in the all the world, I don't know. I have only very little knowledge about my India. So sure, 18 years and above, they are an adult. So there, no one can question them. So this HIV positive is also a problem with the positive. Then the major and very important is tuberculosis. Tuberculosis in the childhood, it can be curable very easily because they have more immunity than the elders. But still it is there. The project is going on. All root level workers are working and they are treating even not only in the rural area, even the higher society also. the children, they are getting because of the bad immunity they have developed in their eating habit also. But suddenly it can be cured. Now the medicines have come up. It's not a such big problem. This is also one of the diseases where we can see in the children. Like this, cancer is quite common. Everyone knows children will get blood cancer, but blood cancer in childhood can be cured if proper treatment is available. So, like this, all the diseases which we have seen in the elder, those diseases we have to face and we are facing with the children too. So, as I say, the children are like batting papers, they are susceptible to get all the diseases very easy. So, we should protect all our children in the society, in the field, wherever we work, even in the who are living in the high society like these metropolitan cities and all. You can see in the junctions, children will come to sell pen, to beg things, to do some dramas. They do wire threading in the corners of the street. They beg, they do dramas, and with the ropes also they do so many dance, music, and all. This is all because of their parent has taught them that work. Parents are the models, I said. As parent is doing the same thing, the child is also doing it. There also they are very much susceptible to get these diseases. So each and every one of us, along with government, we should work. We should help the children not to get diseases and protect them, giving them proper immunization in a proper time, in a proper schedule. This is what I would like to explain. I would like to share with you all. It's a great opportunity for me to get this opportunity. I thank each and every one of this group. Also, I'm ready to answer you if you have any questions. And if you want me to remind me with any other points also, you can remind. Thank you so much, each and every one of you. Sir?
Ma'am, for sharing insights on girls and women's health across various stages. Definitely in this summer season, extra more care, caution has to be taken by everyone because the temperatures are rising due to climate change, we know. So we have to be very careful with these extreme temperatures rising, and even in April itself, the temperatures are so high, and we can imagine what would happen in May. So we all have to be careful and do not expose directly to sunlight, especially in the afternoons. So stay away from extreme sun rays. So these all extra, and drink adequate water and liquids to keep yourself hydrated. So all these, as ma'am said, is very essential, especially for women and girls. So thank you, ma'am, for your inputs. So we are running short of time, and participants, if we are having any queries, you can quickly ask. Otherwise, we'll go for conclusion. Okay. I think it was very clear, ma'am. So there is no further clarification.
Okay, sir. So nice of you. Thank you.
There is appreciation from everyone. So thank you, ma'am, for the wonderful session. So we have come to the end of the day. Just before conclusion, let's watch just a 1 minute, 2 minutes video of two videos are there on World Health Day and World Health Day. Just watch and we will conclude.
Thank you, sir. Thank you very much.
ఇగో నేను పోయేస్తా.
అట్టనే
నమస్తే మల్లేషన్న, మంచిగున్నావా?
నేను మంచిగున్నాను మస్తాన్ బాయ్. నువ్వెట్లున్నావు?
అల్లాకి దయ మస్తుగున్నా. అరే మల్లేషన్న, ఏం చెప్తున్నావు? కిరోసిన్ పోతున్నావేంది? పెట్రోల్ కదా పోయాలే.
పెట్రోల్ రేట్లకు రెక్కలు వచ్చాయి. ఏది పోస్తే ఏంది? తక్కువ ధర ఉంటుందని ఇదే పోస్తున్నా.
అరే చాలా తప్పు చేస్తున్నావు మల్లేషన్న. కిరోసిన్ పోసి బండి నడిపితే పొగ బాగా జిమ్ముతుంది. ఇప్పటికే మన సిటీలో పొల్యూషన్ ఎక్కువైతుందని గవర్నమెంట్ వాళ్ళు చెప్తూనే ఉన్నారు. అయినా పొల్యూషన్ ఎక్కువైతే మనకి కదా ప్రాబ్లం.
పొగ పొల్యూషన్ జాంతానే. అయినా బండ్లలో పొగ రాకుండా గేమ్ వస్తుంది, వచ్చిన పొగ గాలిలో కలుస్తుంది. మనకేంది బాయ్?
అరే అల్లా,
ఇగో పెట్రోల్ కంటే కిరోసిన్ పోస్తే నాకు రోజుకి 200 ఫాయిదా అవుతుంది. ఎదికేనా? ఇక చెప్పింది చాలు గాని పోయి పని చూసుకో.
నీలాంటి వాళ్ళకు మంచి చెప్పు తినబడేది. అందుకే అంటారు చెవిటల ముంగట శంఖమూతి ఏం ఫాయిదా అని. ఏమన్నా వేసుకోపో.
అరే నీలాంటి నీతులు చెప్పేటోళ్ళని మస్తు మందిని చూసినా. పో పో. ఇక్కడ అలాగా ఇప్పుడు వస్తున్నా. రంగమ్మా, డాక్టర్ ఈవిడ నా భార్య.
ఊపిరితిత్తుల సమస్యతో ప్రాబ్లం, పొల్యూషన్ ఎలర్జీ.
అంటే
మనం పీల్చే గాలి మంచిదైతే అది ప్రాణవాయువై మనల్ని రక్షిస్తుంది. అదే గాలి పొల్యూట్ అయితే రోగాలతో మనల్ని వేధిస్తుంది. నీ భార్యకిప్పుడు గాలి పొల్యూషన్ వల్ల ప్రాబ్లం వచ్చింది.
అయినా పొల్యూషన్ ఎక్కువైతే మనకి కదా ప్రాబ్లం.
పొగ పొల్యూషన్ జాగ్రత్తనే. అయినా బండ్లలో పొగ రాకుంటే ఏమొస్తుంది? అరే వచ్చిన పొగ గాలిలోనే కలుస్తుంది. మనకేంది బాయ్? పొగ వస్తే గాలిలో కలుస్తుంది. ఆ గాలి మనందరికీ హాని చేస్తుంది. ఇక గాలి పొల్యూట్ చేయ మీరు చేయకండి.
అవును, వాయు కాలుష్యం మానవాళి మనుగడకు హానికరం. దాన్ని నియంత్రించడంలో మనందరం భాగస్వాములవుదాం.
ప్రజా రవాణా వ్యవస్థను వినియోగిద్దాం, వాయు కాలుష్యాన్ని తగ్గిద్దాం.
Thank you, everyone. So let's all help to control air pollution. That's a message for that. And invest in the planet. This is the only planet we have. So let's ensure that the planet is clean, green, and safe and healthy planet. So I will thank all the speakers for the day. On behalf of Sri Holistic Health Foundation India, Sri Research Institute, and Center for Arts, Sciences and Wellbeing, I thank all the speakers. Dr. Prateek R. Kiran, MBBS, MD, DGM, Associate Professor, Department of Community Health, Convener of Disaster Management Unit, Faculty at the Department of Medical Education, Coordinator, the Senior Citizen Health Service at St. John's Medical College, Bangalore, and Dr. Suresh C. Pandey, Ayurvedacharya, Sri K. B. Satish, yoga practitioner and trainer, and also advocate, Srimati D. Divya Bharati, nurse and counseling psychologist, Mr. Nagaraj, past president of Rotary Bangalore Abilities, and also Deputy Manager, State Bank of India, Bangalore, and also member of various professional organizations, and Sri Arun Mohan, Rotary Bangalore Abilities, and also governing council member of Multiple Sclerosis Society of India, Dr. Ravindra RM, consultant psychology, medical psychiatric social work, counseling, spiritual mentor and guide, member of various professional associations, visiting and guest faculty. So environmental, social, nature, wildlife, animal welfare, health promotion, conservation activist, and all other Srimati Vasanta Talya Ramarao, and also Sri Bhagwan Reddy Garu, and all the eminent speakers for the day. And at last, all the participants without which this webinar couldn't be successful. Thank you once again, everyone, for joining us. And the feedback link has been shared in the chat box. Kindly fill up the feedback form before you leave. It is mandatory to receive certificate. We have shared the feedback link in the chat box. Kindly fill up the feedback form before you leave the webinar. In the meanwhile, if someone wants to share your feedback, you can give it. Otherwise, once you fill the feedback form, you can leave. And kindly join the Telegram channel. It is mandatory because all the updates will be shared through Telegram channel and website. You'll get all future updates, e-certificate link, and upcoming programs, registration links and information through Telegram channel. So do join Telegram channel. Thank you everyone once again. Whoever has filled the feedback form, you can leave the webinar so that we know how many are left to fill the feedback form. Kindly find the feedback form in the chat box and fill up the feedback form. All the certificates will be issued within 15 working days. You can check in the Telegram channel and also respective website for e-certificate link.
Thank you very much, sir. And I'm leaving the session, sir.
Yeah, thank you, ma'am. Fill up the feedback form, ma'am, before you.
Yes, sir. I picked it up, sir. Thank you.
Yeah, thank you, ma'am. Jyotsna, ma'am, do you have something to say? Feedback form has been shared in the chat box. Kindly fill up the feedback form before leaving the webinar. Certificates will be issued within 15 working days. Kindly fill up the feedback form. It's available in the chat box.